Nancy, you'll appreciate this. I think I did my job.
We're live on YouTube. Mary, are we able to start?
Mr. President, we are ready in 5, 4, 3, 2, 1.
Good morning, everyone. Welcome back to the Montgomery County Council. We're beginning this morning after the proclamation we had a few minutes ago with general business. Madam Clerk, do we have any announcements, agenda changes, or petitions?
Yes, good morning. We have an addendum. Number 6 on the consent calendar, a postponed action, G, resolution to appoint members of the Commission on Redistricting. The action will be postponed until 1/26/21. Number 9, a correction at 1:30 for the public hearing. Zoning text amendment 20-08 concerning residential care facility, continuing care retirement community. The Fed committee work session will be scheduled at a future date. Time change for number 12 at 2:35, council fiscal update, and time change for the adjournment at 4:05. Also under general business, under announcement, agenda and calendar changes, number 1, the council is seeking applicants to serve as the council representative on the Board of Investment Trustees for the Montgomery County Employee Retirement Plans and the Board of Trustees for the Consolidated Retiree Health Benefits Trust. The deadline for applications is January 25th, 2021 at 5 p.m. 2B, the council did not receive any petitions. That is all, Council President.
Thank you so much, Madam Clerk. Now we can have an update on COVID-19 from Drs. Gales and Stoddard. We'll be sitting as the Board of Health. Dr. Gales, welcome back. Dr. Stoddard, welcome as always. Please.
I'm sorry, Mr. President.
Yes, sir. Yes, ma'am.
The approval of the minutes, can you just ask whether or not those can be approved, please?
Thank you. That's. Can I get a motion to approve the minutes, please?
Let's approve the minutes.
Councilmember Reamer moves. Councilmember Navarro seconds. All those in favor of approving the minutes, please raise your hand. That is unanimous. Thank you so much. Dr. Gales.
Good morning, everyone, and I hope everyone's doing well. Am I able to share screen and share PowerPoint with you all? Am I able to do that?
I believe so, Mary.
Okay.
Yes, sir.
All right. Is everyone able to see COVID-19 updates?
We are.
Okay. Before I launch into the slides, I do want to provide a couple of points of background. The case numbers continue to be elevated, although we have seen the last several days the statewide totals as well as some of the local totals decreasing. And in the call this morning with state epidemiologist, there was a question of whether or not we have kind of absorbed the post-holiday impact. It is still too early to determine if we have completely passed that wave of post-Christmas and New Year's cases, because part of the other concern is we are also seeing increased concern for potential COVID variants that have been discussed across the world, the globe, and the country. We have seen 3 cases of the UK variant of the COVID strain in the state of Maryland. My understanding, none of those cases are involving Montgomery County residents. And the state continues to expand its ability to do enhanced sequencing of COVID samples to determine if any of those variants, including the UK variant or a number of others, including one that has been noticed in South Africa as well as in Brazil, are here. We think that so far, based upon the surveillance information, we've only seen the 3 cases of the UK variant. And the reason why that's concerning is because these newer variant strains are more contagious and more easily transmitted. And so we're awaiting more information to determine the full impact. When we look at hospital utilization, 3 of our 6 hospitals are in the alert zone, in the red zone for alerts, based upon the availability or lack of availability for acute bed and ICU bed staff coverage. And so even though we're going to talk a lot about the vaccine, I just wanted to remind folks that we still have an active pandemic going on that necessitates continued testing, enhanced testing, which we've been providing throughout the pandemic, as well as increased alertness in terms of the actions that folks need to take related to preventing the spread and hopefully keeping people out of the hospital. From a state level, I believe the hospital numbers have come down to somewhere in the 7,100 to 7,200 range. As you know, the state trigger system for further surge capacity is based upon the first trigger is set at 8,000 hospital beds in use and then 9,000 and 10,000. So we'll continue to monitor those trends. Now, moving to the topic of vaccines. Obviously, lots of questions, lots of moving parts related to this. This slide breaks down and shows the number of shots that have been provided, the different vaccine types based upon our particular jurisdiction. Right now, we are in the priority 1A group, including our healthcare workers, urgent care workers, public safety, and other individuals who've been identified based upon the prioritization model that we set forth several weeks ago now. And we'll continue to move through these priority groups. The state announced for them that individuals who are over the age of 75 were eligible to receive the vaccine starting on yesterday. And they're planning to move forward with allowing individuals over 65 access to the vaccine on next week. Now, when we break this down by the number of vaccines administered, this chart is inclusive of not only the vaccines administered by the local health department, but it also includes those vaccines that have been administered by the health systems, as well as nursing home facilities who are part of the Federal Pharmacy Partnership Program. And so you can see the number of our first doses with the dark blue and the number of the second doses. Part of the health department provisions, which we'll talk about in the next slide. This week we received our first set of second doses for individuals who had received the first dose a month ago, including myself. I will be getting my second dose on tomorrow, and hopefully we'll have a seamless experience and be able to report back and hopefully not have to talk about any symptoms. Now, on the right side of the chart, we see the percentage of population vaccinated. Naturally, we have the largest population in Maryland, so even though we are vaccinating more people, it's taking a longer time to chip away at the percentage of individuals who are covered within our jurisdiction. You can see us at 3%, and the statewide average is 3.5%. Now, I do want to update in terms of where we stand for the health department distribution. Again, at this point, we have been only utilizing the Moderna vaccine, which has been provided to us. As of yesterday, we had received 19,800 doses. We had administered over 18,860 doses. And we did receive word yesterday late of our allotment for the upcoming week, which would include 7,300 first doses, as well as 4,300 second doses, again, as we start to move through those individuals who received their vaccines a month ago so that they can complete their series. And when we break this down by looking at how we compare to other counties, we have vaccinated the most people, we've administered the highest number of doses, as well as we have administered the highest percentage of doses within which we have been supplied. Now, I would caution, I know this was a subject of lots of debate last week. we have a fixed number of vaccines that we're receiving. Now, let me be very clear so that there is no confusion moving forward. We have recommended or requested the maximum number of doses that we can receive each week. We have not underbid that. We have asked the state to increase our total received each week. And we are at the mercy of what the state supplies, and the state is at the mercy of what the federal government supplies to them. So even in the setting of the governor and others increasing access to the vaccine and moving through different phases, what has not changed is the number and the allotment of doses that the state has received from the federal government. There are two factors that influence that. One, the former secretary, who's since resigned, Secretary Azar, mentioned last week that they would be increasing access to reserves of vaccine for states. There was no reserve of vaccines. Secondly, again, there's been lots of comments about moving people through the queues and increasing access, whether we call it the Southwest model, however we want to describe it. But the fixed number has been the allotment of doses going to the states. Right now, Maryland is averaging somewhere in the 70 to 75,000 range of doses that they're receiving on a weekly basis. This has been a fixed number. That number has not changed, and it is likely not to change in the near future. So all of the vaccines that we're receiving at the health department level or in other entities as we continue to move through the phases are being pulled from the same fixed number of doses. As we also move forward, for example, when the state has moved forward with 1B, that also allows for provisions for vaccinating the remainder of our long-term care facilities, including our assisted living facilities and our D&D group homes. Now, while those doses don't pull directly from the doses allocated to local health departments, again, you're looking at doses coming from a common supply area. So again, as we increase the number of folks and entities who have access to the vaccine, that number is increasing while the actual allotment of doses is not changing or is not changing at a significant pace. So I just wanted to put that out there. Now, here's the different pods that we've utilized. Historically, we've been aiming to vaccinate somewhere between 2,500 and 3,500 folks on a daily basis as a combination of these different sites. On last week, towards the end of the week, we brought on Quince Orchard High School as an additional site to provide vaccination to folks who qualified and met the criteria. And then again, this is just another chart to break down and show the number of vaccines received and administered by the raw number as well as the percentage. And you can see where we compare and stand in comparison to our neighboring jurisdictions and other jurisdictions across the state. And this looks at and breaks down the hospital administered vaccines. And again, some of these are covered in systems. For example, we don't have specific data from MedStar Hospital as it is included in the larger the MedStar system. And then, for example, Suburban, it's included in the larger Johns Hopkins numbers. Just to remind folks, here are the groups that we are vaccinating based upon our tiered model. Here are the folks in Tier 1A, Tier 1A, Tier 2, and we've also included folks in Tier 3 to provide provisions for access to the vaccine as well. And we're continuing to move through these categories and hopefully get these folks covered. And the next group would be 1B, and that would include individuals age 75 and older. And then moving further down into Tier 2, looking at other essential workers based upon these particular categories. And then just as a reminder, 1C would include individuals over the age of 65, between 65 and 75. And the Tier 2 group would include individuals who are 16 to 64 who have certain medical conditions that put them at risk of severe COVID-19, and then other essential workers not covered in those tiers. And just another group reminder of how these down and where we stand in terms of our progress in getting them vaccinated, as well as how this matches up with the state system. And again, want to remind folks is that individuals who live in these assisted living facilities, non-nursing home assisted living facilities, are getting vaccinated through the pharmacy partnership with the federal government. We have over 400 homes who qualify for this designation in Montgomery County. All of them have a pharmacy partner, and those first doses are in the process of being scheduled. Think a good portion of the facilities have start dates within the next several weeks, within which their residents as well as their staff will be receiving those vaccines. I would also like to bring up another point. For example, when we talk about the developmentally disabled group homes, there are individuals who meet that criteria who are not in those home settings. For individuals who do have a diagnosis of a developmental or an intellectual disability, they are eligible per state criteria for vaccination during the 1B period. Any staff who care for them outside of the congregate living situation would be eligible in the 1C category. That is a question that we received last week, so we want to make sure that we clarify that before moving on. This shows just the timeline in terms of the doses that we received. And again, this upcoming week, I think we're going to receive the vaccines later on today to put into circulation starting tomorrow, is inclusive of 7,300 first doses and 4,300 second doses. Now let me see if I can do this correctly. I want to stop sharing my screen. There we go. So a couple of updates in addition to the slides in terms of efforts that we've put forward. We have to expand our capacity. So obviously a rate limiting step is the amount of doses that we have available. That's a given. And you're going to hear me say that over and over again today for the folks at home to understand. And I think for folks trying to get an understanding of how we're moving forward, the context and restraints that we have. Now, that said, we are working to actively scale up our operations because hopefully at any given point, there will be an increase in influx of vaccines and we will be ready to go. So the team is continuing to work to identify larger venues to be able to accommodate larger numbers of folks to come through, whether it's related to parking as well as having a larger room for observation space after people get their vaccine. We are also continuing conversations with our hospitals to stand up multiple satellite clinics that will be able to be utilized in addition to the county sites that are currently in place, particularly hoping to be able to stand up opportunities for vaccination on weekends so that people have multiple access points there. We're continuing to also discuss strategies in terms of how to increase access for individuals over certain ages where there may be concerns about accessing the county sites. I'll be very clear, part of the challenges in doing mass vaccination, it does not leave lots of opportunities to do smaller one-off niche boutique type opportunities for vaccination. And we're continuing to look at how we can partner with groups to be able to expand access in those particular spaces. We've received a number of requests from specific venues to have clinics at their sites. We'll look into those, but also making sure that from an equity standpoint that we think very carefully about how we do that and make that available to all folks across the county and not in just one specific location or one specific venue. So that is being worked on right now. We're continuing to get updated from information from the state on a daily basis as details come out. For example, it was announced that there may be access to certain pharmacies within the county, particularly at Giant, and providing vaccination. We're waiting more information in terms of what that would look like because we do expect that once that comes online, we'd like to have more details so that we can keep our general public updated. But we'll be able to contain what we anticipate are a lot of people moving in to get vaccine access. I will stop there. I'm happy to answer any questions that you all may have. I know that Dr. Kroll is on as well, and he may have some additional insights before turning the floor over to Dr. Stoddard.
Dr. Kroll, thank you.
Good morning, Council President Hooker. Hope you're doing well and hope family's doing better in your recovery. So yes, I wanted to have a chance to follow up on some of the things that as Dr. Gales and his team in public health are working on figuring out how to get us more doses and how to get those doses, create opportunities for folks to get vaccinated. The rest of us are working on building that road of access to the point where they can get vaccinated and letting the public know about what's happening in vaccination. So there are a couple of things that we've done that I wanted to update the board on. We on Friday we updated our webpage to include and invite persons who are in the 1B category who are 75 years or older to pre-register. Stood that up on Friday night, and the last count I have was that between Friday night and I think at least close of business yesterday, 52,950 people have signed up for that site in that site. So it's gotten a fair amount of action just in the time that we've stood it up. Folks are really clearly registering, and most of those people, as of Saturday in any case, were folks who were 75 and plus. Not everyone, but there were folks who were over the 75-year-old mark. We sent that notification out, just so you know, for communication purposes, through our web pages, through county portals. We sent you all notification of it so that you could share it. We sent it to faith-based communities, minority health initiatives programs, and we ask our regional service center directors to use their listservs to get that out to the communities. Today, we'll be asking rec and libraries to send it out, as well as MCPS to update that information. One of the things that we know we need to do, and the team is working on it, is adding a pre-registration confirmation so that as people get registered, they get an automatic confirmation, yes, you've been registered, and are then, in an ideal world, if we can make that happen, enrolled in automatic updates, so that if they want, they can get updates on where they stand and what's happening with vaccination in the county and our county effort around that. The team, DTS and IT teams are working now to get ready for pre-registration for 65 and older, and other residents who might be eligible in under Tier 1B. So it's a rolling process. They'll continue to create pathways for folks and give them information as well. We anticipate that there's going to be a need for support for some residents who may have difficulty with the online process, whether it is pre-registering for us or registering in the PrEP mod system when it's available. So we're creating a call center that will help. We'll take calls from folks who need assistance with online registration. And we've also asked our community partners, the faith-based community, to identify folks in their community that might have need some help, and ask them to help them in this moment, because it's fairly straightforward. To have someone walk a person through or guide a person through it. In the longer term, we're also in the process of asking our community partners to support older adults who might need, at the same time, adults who might need that help. Longer term discussion about partners about community partners and ways in which they can help now and in the future to get vaccine, to make people aware of vaccines, and to help solve some of the challenges of getting people and vaccines matched up as quickly as possible. So to Dr. Giles's point, we have limited doses, so we are limited in what we can put out. But as that becomes available, we will need some help from the community and some strategies in place from the community about how we get people to the vaccine. We are working on our ramping up our collective vaccination preparedness campaign. So the survey went out to the communities in all 8 languages this past week. Focus groups are following, and we're doing joint messaging, as I think you referenced the joint town hall that we're doing this evening, and other events around the county to get information out and to make sure there is good information out to the public. Starting this week, today, I believe, we're sending a daily update to council that has sort of key facts and information about vaccination in Montgomery County, such as we have them, that can be used to update facts through your websites and your portals and in your meetings and conversations with folks and in answering questions to your constituencies. I'll end the way that Dr. Gale started. We don't know yet what the state plan is going to be for ongoing equitable distribution of vaccine, either to hospitals, congregate living facilities, or distribution through the Giant and Walmart plans yet. We expect the state has indicated that they expect to continue to receive a fairly fixed number of doses from the federal government each week, in the 70,000+ a week. How they're going to distribute that to us or to any of these other routes is unknown for right now. So it's a question that we have to watch and react to as it evolves. So I'll stop there and turn it back over to you, Council President.
I think it bears repeating your last sentence that we don't yet know what the state's plan is for equitable distribution. Thank you. Unfortunately, that's the case. That's the situation we're in. Dr. Stoddard.
I just have a few things I want to add. I've got some, I guess, hot off the press news. It looks like the Giants in Montgomery County will receive approximately 50 doses a day per site. They expect to distribute 30 to 40 doses a day per site. There are 4 sites in Montgomery County. As I don't think it bears illustrating, that's not a very significant level of vaccine for them, and nor will it put a significant dent in the population that we have to address. So I think that should be clear. And also, so we're clear, the Giant sites will require that you have an appointment. That will not be walk-up. So we're concerned about what we see on Monday in terms of, hundreds, if not more, people trying to show up to the local Giants to get vaccine. I've already contacted Chief Jones from the Police Department, and he will be working with Giant Security to ensure that they have a strategy to make sure that those places, not just from a crowding perspective, but also we don't want to be spreading a pandemic but by having people interested in getting vaccinated for a pandemic. So we're going to be making sure that the distancing and things like that are followed at those sites. I think some of the numbers we should correlate with one another. We have 53,000 people registered for 75 and older. We believe a significant portion of those are over the age of 75, as they've listed. We've received 7,300 new doses of vaccine. My degree is not in math, but I can tell you that is multiple weeks of vaccination before we even get through our 75 and older population. And so the notion that we would be moving to 1C next week with the rest of the state, I would not suggest is going to be reasonable. We intend to follow the criteria as laid out by the state for 1D and 1C, and we'll move through those categories as quickly as we receive vaccine to cover. We don't want, some of our other healthcare providers like our dentists to think that we're going to skip them. We're going to cover them this week. We're going to hopefully try and move into 75 and older as we get, later into the week or early next week. But obviously, it's all incumbent upon, as we've said multiple times, we're not going to have vaccines sitting in a freezer or refrigerator waiting for someone to show up. If people don't accept the appointments, we will move on to the next category. We'll move through the categories as quickly as the vaccine allows us to do, and we'll move on and get through as many of these as we can. I think our biggest concern about the governor's announcement is that it's created a massive expectation that there's something available to people that there is not. And we just want to keep reminding people that Montgomery County has been the most efficient jurisdiction in the state in terms of getting vaccine out. One of our big efforts has been to push our hospitals to do the same, and they're on board with that. We are getting, hospitals will be standing up sites this week. They will be providing us the information about where those sites will be. We're going to map those all out, hopefully by the middle of this week. And then we'll be able to know where we've got sites and where we don't. And it's very likely that we will, in conjunction with the hospital, be setting up an additional larger site that's sort of a partnership between all the hospitals in the county. We're going to pick a location based on where all the other locations are and where we need to have more vaccination opportunities based on equity considerations and where we've seen the most impact from COVID-19 thus far. And so there is more supply potentially coming online in terms of activating the hospital doses for the public, but there is not more supply coming from the federal government, nor is there going to be a greater distribution to Montgomery County. And that should be, I don't mean to be pessimistic, but I think we have to be realistic about the expectations moving forward. So I will stop there and happy to entertain questions.
Thanks so much to all three of you for getting us through this next stage, or beginning to get us through this next stage, and to all your staff as well. We all really appreciate it. I want to remind everyone what's been said about the town hall meeting we'll have tonight to answer more questions from the public. We wish we had more answers than we have, but we're going to continue to try to answer all the questions we receive with the best and most current information as we have it from the state. Can I just ask maybe Dr. Stoddard or any of you, I know you and I had a colloquy over the weekend about social workers. Where do they fit? Do they fit in more than one category if they're front-facing or not? And can you mention what, Shepard, how if there's any impact of on our social workers of Shepherd Pratt's offer to vaccinate Maryland licensed social workers.
I can start. We originally, when they had the initial healthcare survey up, did include a snippet about patient-facing licensed social workers being eligible as part of Tier 3 of Phase 1A. I think when we modified the site to clarify the language on the survey, that came off. And so over the weekend, we just specifically added that statement, which is patient-facing licensed social workers, to one of the called out groups in Tier 3 of 1A. So if there are social workers who, again, are licensed and front-facing, they should absolutely be registering through the healthcare survey and would be included in vaccinations as early as this week.
Thank you very much. Okay, we have a lot of questions from my colleagues. Colleagues, I should have done this last week, but let me invoke the 5-minute rule so we can be fair to everybody and come back around to those who have questions, who have additional questions. Let me begin with Councilmember Glass.
Thank you very much, Mr. President. Good morning, everybody. I want to reiterate a comment that was made during this presentation, that we are at the mercy of the state, and the state is at the mercy of the federal government. And it's just another reason why I am so incredibly hopeful that come Wednesday afternoon, President Joe Biden is going to help steer the ship and get us the vaccines that we need to keep all of our residents healthy and safe, because we certainly need leadership at the federal level. And the presentation that was provided, Dr. Gales, thank you for all of that deep dive. While I'm hopeful about the presidential leadership, I am somewhat perplexed about the state leadership regarding the fact that Somerset County, wonderful residents of Somerset County, 22% of them have received a vaccine. And the population of Somerset County is about 26,000. So I'm trying to figure out how the state is fairly and equitably distributing the short supply of vaccines that we have, and why here in Montgomery County, with a population of nearly 1.1 million people, our residents are not receiving more. And so with all of that information, over the weekend, a large number of constituents have contacted me regarding an online form from the state saying that they could sign up and pre-register to receive a vaccine, and that they would receive that vaccine at the Prince George's Sports Complex. Either Dr. Gales or Dr. Stoddard, can you talk about that and help enlighten everybody about what this form is and whether Montgomery County residents can sign up and pre-register?
Sure, that's a great question, Councilmember Glass. So to your first point related to how the vaccine is being distributed, so I do know that of the amount that the state receives, they have to split it. And so part of that, I think approximately half of the doses are allocated to the health departments, and it's based upon population as well as utilization. In terms of what goes into factory. Each of the health departments also have the opportunity to, as we discussed, to request a volume of vaccine, which we do on a weekly basis based upon our capacity and ability to execute. And I want to confirm once again, we have been requesting maximum amount of doses. We've not been undershooting what we put forth. Each week that request has increased. So to the point of these multiple places where folks can register. So Deputy Secretary Chan, I believe there's an interview in the Post today, mentioned that residents can sign up and go to other counties to get vaccine if there's slots available. That's really all I have to say about that. So until we get more information, but based upon what I have received so far and what I understand is that if there are these slots available in other areas, folks can utilize those. I do also want to caution how we view that. So for example, we received an email to say, well, Prince George's has all these slots available. Why doesn't Montgomery County have slots available? Well, if you look at the chart that we showed, the reason why we don't have slots available is because we pushed out all of our vaccine. We've distributed 95% of it, so we don't have any left. And so some of the other counties, for example, I think Prince George's, and this isn't knocking them, I think to date has only administered somewhere between 15 to 20% of their doses, and they're getting up to speed. So hence, at least in the short term, it appears that they have more appointments available than we do in point of comparison.
I do know that
Dr. Starter, yeah, go.
Yeah, I do know that they have a 10:30 a.m. press conference this morning where their county executive, also Rooks, will be going through exactly their process. I don't want to say anything out of turn, but we do have reason to believe that they're going to use a pre-registration process moving forward based on what they've learned over this past weekend. Because obviously there's going to be lots of complication with Montgomery County residents going to Prince George's County to be vaccinated. For example, who will be responsible for their second dose of vaccine, and who will be allocated that dose to give it to them? And so I think we generally are supportive of the notion of having there be multiple opportunities for people to be vaccinated, but we do know other counties are not offering vaccine outside of their own residents. And so we just wanted to be, again, fair and equitable across the state in perspective, either follow one set of rules for everyone or not. And we're hopeful that, the Maryland Department of Health would clarify. And it seems like Dr. Chan made a statement, but I guess the question ultimately is are they going to enforce that as a policy across the state? And one way or the other, we would hope that they would.
And I would just add one last fact around this piece of information around this. Is that I saw a note that Caroline County, for example, had put up a note that said that they were registration was open for Caroline County, I believe it was Caroline County staff only, or Caroline County residents.
Okay,
so
well,
there's some unevenness around how it's being described.
I see my time is up. We'll certainly be following the press conference in Prince George's County, and I'll be following up to you all as well, because our residents are holding on to the fact that they have received slots in March, right? And I know that we don't even have enough vaccines for next week. So
I think they'll be addressing that in the press conference. My understanding is that after a certain date, they will be canceling those appointments and asking people to pre-register. But again, we'll wait for the press conference for Georges County to describe those details. We have conversations with them, but I think there was still a little bit of back and forth on that decision.
Thank you.
Thank you. Councilman Reamer.
Thank you very much. Appreciate the update. So much going on. Thank you. Well, the issue of Montgomery County residents signing up for the vaccinations in Prince George's County, I think we might all agree, stepping back, there's some issues there. I'm concerned about the equitable rollout of vaccination campaign broadly in the state. And I think it speaks to the need for us to move more quickly to open up to seniors here. And the fact that people are getting notification of an appointment in March, even though that's a time away, our residents have been hanging on for 10 months, social distancing, and some of them have to go into risky situations daily, and some of them don't. And those who don't might be comforted knowing that at least they have an appointment. It may not be soon, but at least they have an appointment. And so I think it's really important for us to begin vaccinating older residents, 75 and up. I'm unclear what the county's view on doing that this week is. I think we need to do it this week. I know we have successfully administered over 95% of our doses. It also appears that we start the week with 900 in the inventory. Why can't we have a policy that 100% of our doses will be administered, and we can draw from the older residents? Minimally, we can draw from the older residents to ensure that that's the case. But I just think that there's so much anxiety out there because older people are hearing that they can get vaccinated in Virginia, they can get vaccinated in DC, they can get vaccinated in Prince George's County, they can't get vaccinated in Montgomery County. And that is untenable. Like, we have to be able to offer that. I think pre-registration was a help, and I really am just appalled by the state not setting up a statewide pre-registration model from the very beginning. I think it would have the fact that thousands of people have probably signed up for appointments in Prince George's County without a pre-registration tool is just a terrible example of this failed rollout, but, I think it will help ease the anxiety level to know that it's open. I think a lot of seniors feel that they are at the highest risk of death and they need to be prioritized. So, Dr. Gales, Dr. Stoddard, can you provide an assurance that we will have some vaccinations this week for older residents?
Councilmember Raymer, thank you for your question. That's an excellent question, one that we've thought through lots. We can't promise, again, to reiterate what we said all along. We're at the mercy of the allocations that we have and trying to move people through. Now, we've discussed internally how we could potentially open up access to those over the age of 75. As you highlighted in your question, the reality is opening that up will not change, however, the number of doses available. So there would likely be significant wait times for folks to do it. So there is no winner in the situation, because if we continue with prioritization, which has structure there, we're still at the mercy of doses. So it's a time-dependent thing that we've got to move through. No, that said, if we do open up access, which Dr. Kroll and I actually had a great conversation this morning about, is one potential strategy is to say, while we have to continue to get all these other folks through 1A through that process who are actively going out and working and being potentially exposed, it's a trade-off. So we've still got to get those folks through the queue, but, potentially making an allotment to say, percentage of doses for, at the end of the week could be, specifically for those who are 75. So we're working through that strategy. We're going to talk and discuss that further after this. But you again, as you highlighted, there is no easy winner, because with the fixed allotment, we may be in a situation where we are like other jurisdictions like New York and LA, where folks are getting appointments, but they're 2 to 3 months later. And again, even then, we don't know what the allocation would be to even set up those appointments in terms of a clinic. Right now, we're setting them up on a weekly basis once we get confirmation of the doses that we'll receive. So please stay tuned. We are thinking about it.
This week would largely be a choice between, This week would largely be a choice between 75-year-olds and healthcare workers. That's who we'd have to choose to vaccinate. And so, and I want to make one thing very clear: the 894 doses that we had or so from last week are people. We have less than that because people have already been vaccinated this morning using those appointments. The clinics are already open and running. We've not received our next allocation. So by the time we receive our next allocation, presumably either this afternoon at some point, we will largely we'll be at 100%. So there will be no rollover. So just so we're clear, we haven't received our next doses, and we have clinics running right as we speak here. But I mean, the point is, we have dentists, we have pharmacists, we have other healthcare workers, behavioral health, rehabilitation, who've been waiting to get in line behind the hospital workers and others. And now we're vaccinating those folks. At the end of last week, we believe we have between 15 and 20,000 of those individuals still left. And so we would have to if we're going to vaccinate 75-year-olds this week, it will be basically saying we're taking doses away from healthcare workers and giving them the 75 and older population. That's the choice that we will make, which I'm not saying it's a wrong choice to make, but I want to make clear that those are the kinds of choices that we will have to make.
I understand nothing is easy about this at all. The mortality rate of older residents is so high. And I think our community just needs to feel that they're a priority. Seniors need to feel that they're a priority. And we are now, weeks, a month nearly into the actual administration of doses. And they're not hearing from the county. So I understand I understand why the response is, but we won't be able to offer an actual dose for weeks. If I was in the shoes of a person over 75, I would rather have an appointment for a month from now than not know if I'm going to get an appointment. It will put me at ease, and we'll know at least a general idea of how much longer am I going to have to keep this up. And I think it will be comforting to people. So I would really encourage that. Thank you.
Thank you. Councilmember Friedson.
Thank you. Just to build off some of this, I understand you're in an impossible position. I share the frustration that there should have been a statewide pre-registration, there should be a more methodical approach. I think, unfortunately, residents don't really care. Our pointing the fingers at the state pointing the fingers at us. I think we all know that. We all appreciate that. There's a lot of concern and uncertainty out there. I mean, to paraphrase one of my favorite movies, residents have no information. They're in the desert desperately searching for a mirage. They can't find it, and so they're drinking sand because they just are desperate to know where they can possibly get vaccinated. And that's why when they see an appointment in some other jurisdiction and anybody who gives a modest indication that they might be able to get one, even if it's months away, they're going to take it because the uncertainty and the anxiety and the lack of clarity is killing them mentally, and they're afraid of a virus that might kill them physically. And we have to figure out ways to work through that. A lot of that is from the state. So, number one, for the healthcare worker question, hospitals are sitting on tens of thousands of vaccines. Now, I think it was a strategic mistake to send too many vaccines to hospitals that they weren't equipped to handle. The uptake in hospitals apparently is lower than we had hoped, and we still hope. But in the meantime, there's tens of thousands of those doses. Is there a reason why we can't send the healthcare workers that you talked about, dentists and others, just directly to the hospitals that are already set up sitting on these vaccines, that the county could take the role of the 75 plus?
So as we previously discussed, we've been working with the hospitals for a number of weeks now on developing similar strategies to that. And as Dr. Stoddard mentioned, we actually had a lengthy meeting on yesterday to discuss such strategies and implementing and getting them across the finish line. Now, we're not ready to release those final details. They're still in the oven, making, if you will, and they will be providing those follow-up details later on this week to be able to potentially announce what, all of the different components. Now, there have been instances where healthcare providers have actually already been sent to those facilities to get coverage. For example, at least 2 of the hospitals have been working with the medical society to get healthcare practitioners who are non-primary care specialists to get access to the vaccine. And so what you've asked is already in place in some capacity. But the expectation, again, based upon our recent meetings with them, is that that would be scaled up even more in the coming days. Our expectation is also that by working with the hospitals, you're right, we could utilize and tap into the vaccines they have. They also have been able to get a mixture. So, for example, some of the hospitals have Moderna as well as Pfizer vaccine. And one of the strategies that we discussed, for example, we as a health department don't have Pfizer because we don't have deep cold storage. But, for example, some of the hospitals do. So it may make sense to schedule some clinics or schedule some opportunities in proximity to those spaces to be able to take advantage of the different types of vaccines, again, to maximize the resource that we have at play.
I know you're working on it, but I hope that we can get that done yesterday because
we all do. We all want that.
And it's not your fault. You didn't send them there. I'm not blaming. It's not a blaming situation, but I think that would ease some of the question. If there was clear understanding that the hospitals handled the rest of the healthcare workers and the county handles 75 plus, it would eliminate some of the pressure of the picking and choosing who is the greater priority group, which is one of the impossible positions that you've been placed in, unfortunately, by the state. And I think that would help. So those who pre-registered who are 75 plus, you mentioned that they might not get appointments until next week. Do we have a specific idea of when they're going to find out, when they will get notice, when they will get information on their appointment? Not when the appointment will be, but when they'll find out when the appointment is coming.
Well, 2 things I want to highlight and make very clear. So we prioritize everybody. So for everyone watching at home, if you're 75 or older, 65 or older, you are a priority to us. Everybody in this county is, in terms of getting vaccinated. So just put that out there. But part of, again, the challenge is we're working with fixed doses, and we have this situation where we have to move things around. So the expectation is, again, is we have a clearer understanding of what that looks like. So to Councilmember Reamer's question about potentially allocating doses to 75. We're working through that right now, and hopefully we'll be able to announce as quickly as possible to say, hey, if you're over 75, there are slots open on these days, which underscores the importance for folks signing up to the pre-registration system as well as the county update system so that folks can get that information as quickly as possible. And the other thing I want to also mention with the hospitals that I failed to include is that at least one of the hospitals did say when we were bumping up to the weekend, we didn't know how many doses we were going to get this week, did step in and say they would allow us to borrow some of those doses to help support if we did not find out, our allocation until later and we did not have enough to stand up a clinic today to distribute those vaccines.
Got it. Okay. And then,
Councilmember, could I jump in just for a second around this? Because one of the things that you raise about is about scheduling people and giving them appointments. I get your point about scheduling people up and giving them a set time and an appointment, even if it's weeks out into the future. One of the challenges is it's a toss up about whether or not having an appointment or having one and then having that have to be rescheduled because we don't know predictably how much vaccine we're going to have available from week to week would be more challenging and troubling for a county. Having been in the schedule and having it changed by someone without any input on my part is something that I think will be aggravating for seniors, as much as not knowing from when their time is going to come. So it's
the issue is that there's not a lot of clear communication. People don't understand.
Which is why we're trying to stand up the communication
I'd like
process.
to be put back in the queue, Mr. I think that my 5 minutes, I didn't get a chance to ask a lot of the questions, but if I could be put back in the queue, that would be great. Thanks.
Will do. Council Vice President Albornoz.
Thank you, Mr. President. I don't think I'm going to get through 5 minutes either, so I may have to come back around, but want to be respectful of everyone's questions. And Dr. Gales, welcome back. It's good to have you back. I hope you got some R&R. So I guess the first question is picking up where Councilmember Friedson left off. The 52,000 plus that have pre-registered, can you remind everyone how the determination will be made among those people that have pre-registered? Obviously, it will be weeks before we have a sufficient number of vaccines, but how the determination will be made of those 52,000 and growing, when, who, how, where they will receive the vaccination. Is it based on age? Is it based on first come, first serve? Is it based on geography? And then who makes those decisions? Are we permitted to make those decisions internally, or does that have to be deferred to the state?
Thank you. That's an excellent question. We are striving to ensure that any factors consistent with how we've approached the pandemic response so far, any factors that are put into play to make those determinations create an equitable system for everybody in the county, not just those who may have access to counsel to advocate or access to computers, things like that. And so we're looking at a host of factors, including individuals who are in higher risk categories by age, race, gender, medical condition, also the zip codes within which they live, because as we have seen play out, we have seen a disproportionate impact of COVID on certain communities by race and ethnicity, also by geography. And so we're thinking through those strategies, but also recognizing that all of us have to have a piece and play and ownership. I would encourage in some of our future conversations to also discuss any ideas that you all have as well to incorporate in that, so that, again, we're all working from a consistent playbook that's standardized, and to Councilmember Friedson's point, is very clear and transparent to the community in terms of how those decisions are being made.
So to summarize just really quickly, we are permitted to make those decisions on our own, and understandably, we're taking into account those factors such as geography and those people that have maybe more underlying conditions to prioritize among the group. So which makes perfect sense, and I agree with, but just wanted to confirm. Second question is, do we make the call on administering second doses versus having more of the first dose out in the community, or is that a state call? There are pros and cons to both. I just am trying to confirm, do we make that call, or is that a state decision?
I'm not sure I understand your question, so hopefully I'll answer that.
So
Clarify for.
Yeah, so we received 11,000 vaccines, and 4,000 of those are going to administration of the second dose, which I get. There has been some dispute nationally, and the Biden team is following a slightly different policy than the Trump administration, encouraging just getting more vaccines out as possible within that first dose. And so, there's a question as to, are we making a policy decision to have 11,000 first dosages, as opposed to the 4,000 second dosages? Is that our call to make, or is that a state decision?
So the way that's a great question that actually came up in conversation this morning. So the way it's allocated is the state sends that number based upon, the number of people who we had come through for their first dose before. So they have those second doses set aside for those folks. And for example, I received an email reminder from the PrepMod system to say, hey, you are due for your second dose. Please go in and schedule your appointment. The expectation is that at least in the first wave, individuals who are due their second dose would have the opportunity to go in and make that appointment. Now, if we're finding that a week out that there is a potential number of doses that are available and people aren't coming in for those second doses, our expectation is that we would pivot and utilize some of those for first doses, so they wouldn't be going to waste. So the way it's allocated is a state decision, but I think consistent with other components of the vaccine rollout, we would be able to utilize some local, decision making and consultation on that to maximize folks getting the vaccine as quickly as they can.
And I would also argue that we should want to be consistent with people around us, because I think the messaging gets more complicated the more we diverge from our state regional partners as well. And so obviously where there's good signs on both sides of the argument around first doses versus second doses. You're applying a significant selective pressure on the virus to evade the vaccine if you have incomplete immunity, for example. And so that is a concern if we did this as a nation, would we be selecting for variants of the virus that escape from this vaccine? That is a question that is still out there. And I want to be clear. I think that, we'll do whatever the national strategy is. And I think we're waiting to hear what the Biden administration policy will be on this issue. And we'll be able to adjust accordingly. Obviously, we should hopefully know that over the next couple of days. But right now the policy is second doses, and I think that's what we're planning to do.
Got it. If you can put me back in the queue, Mr. Council President, for a second round, I've got a few more questions. Thank you.
Will do. Councilmember Navarro.
Thank you so much for this update. So I'm sitting here trying to figure out how to assess the situation that we're facing, because this is going to be so critical as we go out there to talk to our constituents in this town hall. There are a lot of questions, and I'm hearing my colleagues ask a lot of very important, particular questions around logistics and things like that. But the truth of the matter is that we barely have any vaccines. I mean, this is an important conversation about details, but I go back to the notion of where are we? We're operating under a paradigm where we literally barely have any vaccines. And so I'm thinking about what I have read and what I have heard regarding the limitations. And of course, we know that a lot does have to do with the outgoing administration. Fortunately, tomorrow things will begin to change. So I guess from a just macro perspective, I would like to know, what thoughts do you have regarding the potential? What have you heard so far, given incoming Biden administration, what they have shared regarding their intent and what they are envisioning they can do, the capacity that exists nationally. So I'd just like to hear a little bit about what are your reactions and what is your assessment in terms of how things may ramp up once they get in there, and then what do you foresee that we then have to do as local leaders, especially leaders in the largest jurisdiction in the state, to then work with our state leadership to make sure that as hopefully the volume begins to grow, what would be those things that would be helpful to us? Because, I tend to be a very logical person. And when I think logically about what we're facing, it's literally, my vision is that we're twisting ourselves into pretzels to try to get out, everything out there as much as possible, which we have. But there isn't much that we can do if we don't have the actual vaccines. And so from your perspective, as we are entering, the dawn of a new administration with new opportunities, in my opinion, an administration that will take this a lot more seriously, of course, what do you foresee happening? Where do you think then we should start right now in terms of being proactive to work with our state leadership? And then what do you potentially see as some of the areas where locally then we need to ramp up and get everything in place to be ready for that moment where we begin to have a much larger volume of vaccines?
Thank you, Councilmember Navarro, for your question as well as your analogy of the pretzel. That's pretty accurate in terms of how we feel trying to thread many needles to fit and get things out. So thank you for that. I'll try to be succinct in this. I think a couple key points with the new administration. I think bright points. I think the first one is staffing. The folks that have been put on the team to lead the effort are very accomplished individuals with diverse backgrounds from industry to public health, including Dr. Chakir, who I worked with in Chicago when he was Commissioner of Health in Chicago, who's overseeing the vaccine distribution plan. He also comes from as the Chief Population Health Officer for Kaiser. So he's got multifaceted background to help release that. And the Biden administration announced this morning that they are appointing or going to put forward Dr. Allison Levine, who's the health commissioner for the Secretary of Health for Pennsylvania, as Assistant Secretary of Health within HHS. So from a staffing perspective and an intellectual capital perspective, I think there's going to be a lot of people there with key experience to help move this forward quickly. I think they also are planning to, in addition to encouraging states to set up testing sites, but vaccine distribution sites, they, from my understanding, will be putting up national centers, utilizing some of these large venues to do national vaccine distribution sites that would hopefully, allow everyone to benefit from, to help decrease, 50 different systems that are in place. There was the expectation that increased production of the vaccine to be able to administer 100 million doses within 100 days. Reading articles, I'm not sure if we'll get to 100 million, but I think we can, aim for the moon and hit still a good target. That will be tremendous. And I think two other factors that are also at play within this is the fact that there are two additional candidates that are moving through the process that could potentially receive emergency use authorization within the next several weeks, not months, including one candidate by Johnson & Johnson, which is a one-dose vaccine. We still don't have the information to show the full efficacy of that. But, that could be a potential game changer. And I know AstraZeneca has another candidate coming through. So more vaccines would be available and, potentially even less doses required that would help be able to make a dent in the numbers. And then the last thing that I would mention is, again, encouraging states to set up networks for vaccine distribution to help support the local health departments. And that would potentially offset some of these huge population density issues, as was brought up by Councilmember Glass, where you see a smaller county having a higher percentage of their folks vaccinated by virtue of the fact that they don't have as many people who qualify. I think you referenced Somerset County having 26,000 people. We've got 50,000 people alone in 1A as healthcare workers. And then when you talk about over 65, that's 180,000 people. So hopefully that will be an added component to support.
I appreciate that. I think that as we have opportunities like this town hall this evening, I would really appreciate making sure this type of framing also takes place, because it is the reality. We all feel the anxiety, right? I mean, I feel the anxiety. I want to make sure I can protect my family. I'm looking forward to that moment where, we're able to have enough vaccine so that we can all get it. So I understand that. And I know that there are some folks right now who are at higher risk. And I want to applaud all of you and thank you for what you've been able to stand up thus far, given the fact that we have this limitation of not enough vaccines to go around. So I just want to make sure that we continually update our residents in terms of where we are in this process. As I said, tomorrow for me, it's, for a lot of people, it's a big day, because I think we start to see a shift, and I think we have to be transparent in how we are set up, and make sure that everybody understands that we have the infrastructure, we're getting there, we're perfecting certain things to get ready for additional vaccines. But at this moment in time, the amount is so small. When I look at that initial slide, you've seen 1 million residents, and the amount that we have gotten so far is just minuscule. So again, thank you for what you've done so far. And we stand ready to hear from you who are on the ground what we can do to work with our state leaders, our state partners, our region, as well as our federal reps, to make sure they understand that we need to be on the radar for them as well. Thank you.
Thank you. Councilmember Katz.
Thank you, and thank you, Council President, and thank you to the doctors who are here as well. Just so I'm clear, if someone signs up on the website, is that only for Montgomery County, or is that for the state?
So if the website that the county has put out,
Yes.
So what happens is when the registration process, so when you go through and do your online registration to get the vaccine, you complete your registration, you complete your consent. And then at the end of it, if it's coming from us, there is a link to all of the, there's a schedule put up that shows all of the available time slots within any of the county systems. So for example, yesterday I registered for my second dose. And, when I completed the registration process, I then was able to go through and see what slots were available within that. Now, I'm not sure if the state link, I confess I've not played around with that one yet, in terms of what provisions they have in place in terms of venues to register. Per report, though, it looks like there are a number of sites that are in multiple different jurisdictions that you can schedule an appointment in if you're using that link.
Well, and that's the reason I asked the question, is because I've had people that have said that they have registered at multiple sites, that they'll, spend hours going from site to site. And does that help them if they do that? I mean, I don't know whether it's strictly a waste of their time. Yes?
Here's the problem we face. The state's registration process, the PrepMod system, is not really built to differentiate between like characteristics of whether you're in 1A, 1B, 1C. And so in many cases, here's the unfortunate problem. People who register through PrepMod, as was done in Prince George's County and can be done elsewhere in the state, may or may not get to that vaccination site in some county not run by Montgomery County, and either A, get through, or B, be turned away. And that will be dependent upon what happens at that individual site in terms of, if they check for an ID in, as we heard, in Caroline County, I think Dr. Kroll referenced, that if you get to a Caroline County site and you aren't a Caroline County resident, they're going to turn you away whether you've got a slot or not. And so this just adds to the confusion, which is why we got a lot of questions over the weekend saying, hey, I'm able to register through Prince George's County. Should I, or what should I tell people who are able to do that? We don't control what ultimately Prince George's County is going to do. There are people from Montgomery County who were vaccinated in Prince George's County yesterday. I factually know that to be the case. Will that happen 2 weeks from now? I do not know. And so answering the question of what should residents do, if I had, for a senior, for a 75 and older person, I would try and register as many opportunities as I could right now and see how it plays out candidly. I think that's sort of what will happen. I know that's confusing messaging, but we can only control the clinics that we administer and not the clinics that other counties administer.
But we have to be fair, and we have to be communicating, and we have to be reasonable. All right. So the whole idea of someone over 75 and then letting them register, and we don't know, even if we gave them an appointment in 3 weeks or a month, we don't even know whether or not we would have the vaccine. I understand where that would be some comfort, but if we gave someone an appointment and then didn't have the vaccine and we needed to cancel that appointment, that would also be even worse for them. I was supposed to get it and they canceled my appointment. So there is no easy answer on this. And we all want people to get the vaccine as quickly as possible. I heard Dr. Fauci speak on Meet the Press, I guess it was Sunday. And he was talking about Johnson & Johnson and that it'll be weeks rather than months to get the new vaccine and how that would be a help because it's only the one and all of that. So that's very positive, as well as AstraZeneca. But if the Biden administration, when the Biden administration gives 1 million doses a day, and if every state were to be equal, we would get another, 20,000 20,000 doses per day. How much more would that be? Is that 20,000 in addition to what we're getting now, or would that be 20,000 total to what we're getting now?
Expectation would be in addition to what we're getting. And I think the added benefit from getting additional vaccine would also allow for the opportunity for the state to allocate doses to private providers. Because again, with a fixed pool, anytime you bring additional people in that you're providing vaccine to, it's pulling from the same pool. So if we can increase that capacity, it not only increases the number that can be provided to health departments to support, but would also allow for private providers and other, pharmacies and other places to come on board as well.
Thank you. And thank you, Mr. President. I see where I've reached my 5-minute rule. Thank you. Came back to haunt me. Go ahead.
Exactly. Thank you, Councilmember Rice.
Well, thank you very much. Excuse me. And I think that a lot of the questions have been asked, but let me just kind of make a comment, and then I'd love to hear feedback. We've heard from residents who have traveled to other states. We've heard from residents who've traveled to other jurisdictions in the state of Maryland to get on the list for vaccines, and some have been successful in being able to do that. What is the overarching strategy? Is it just that as long as folks get vaccines, then it's okay? And because we touched on this before about residency requirements and not really being as stringent with doing that. So we're starting to hear about folks who are going to neighboring jurisdictions and getting on lists and actually getting appointments for vaccinations because they seem to be a little bit more sped up in the process, which also concerns me a little bit about what happens here in terms of how we manage ours as well. Can we just talk about that and what are restrictions, if any, when it comes to residency requirements for vaccinations?
Thank you, Councilmember Rice. To me, your question hits on the heart of equity and fairness. And what we've tried to do, which is why we put in the prioritization model, is to create a system that is fair and equitable, that's based upon criteria eligibility as opposed to who has the means to be able to sit and go through hours and try to, game the system, if you will, in terms of getting an appointment, or who happens to know someone who knows someone, that kind of thing. And so that's the approach that we're going to continue to take and emphasize as best as we can to create some structure as we move forward. Because what we don't want to have happen is, even when we say everybody over the age of 75 is eligible, we know that there's huge discrepancies in terms of access to healthcare in general that exist within groups. And we don't want to see that play out also in terms of who gets the vaccine. And so those are, I think it was Councilmember Albornoz's point earlier, looking at the different factors we're trying to come up with to try to offset some of those underpinnings and influences to make sure that when we do open up access based upon age and other factors, that we've taken those into consideration so that it is as equitable as possible. Now, unfortunately, because of the system, the way it's been rolled out, particularly as it relates to getting the links and things like that, we know that there are people who have jumped the line and been able to get the vaccines earlier than they really are supposed to by the criteria that's been laid out. And I think we've made efforts to, have people bring in proof of employment, things like that. And where possible, certainly we would do our best to try to emphasize residency issues. But, to Dr. Stotter's point earlier, we really are all in this together. And so, if folks do come in, we're not going to necessarily turn people away. But the expectation is that we would work our best and do our best to make sure that the overwhelming majority of folks who are utilizing the county systems are actually Montgomery County residents.
And I want to talk a little bit more about equity because I think it's really important. So just to give you a flavor, so when we launched the pre-registration site for 75 and older on Friday, when we looked at the data on Saturday, this is what we saw. There were approximately 30,000 people who had registered. There were approximately, of those, 1,322 people who identified as Black or African American, and approximately 1,643 that identified as Hispanic. Those ratios do not look like Montgomery County. And so if we did a first come and first serve basis, we would not be reflective of our community. And so, that is not our intent. And we've seen the mapping that happened in the district. And this is, again, not to criticize the district at all. We're all learning lessons throughout this process. But if you looked at what happened in one ward versus another, there was a total inequity in terms of the doses. And they've had to adjust clinics to address that. But I think we're trying to learn some lessons based on the experiences happening in other places and what we're seeing in our own data to ensure that as we open these rounds up, they look like Montgomery County residents, our population, but also it told us a lot about we've got to do a better job getting this information about there being a pre-registration process in more of our communities. And that's been the push that we've been making this week. And so even as we look to have a first clinic for 75 and older, we're trying to really ramp up who's pre-registered so that we can have a clinic that is more reflective of Montgomery County and not just people with digital access and digital literacy enough to get into a pre-registration for a system first.
So, Councilmember Rice, just to add to that, just looking at the numbers through yesterday, we don't have today's number or yesterday's numbers, but total of population who've done a pre-registration is 44,800, and of that at this point, approximately 31,000 of those are over the age of 75. So we're hitting an age range that we need to hit, but 8,000 of them are younger than age 75. So we're seeing some of that. The white population for the county, 34,600 of those 44,000 folks are folks that have signed up at this point, compared to much smaller numbers for the Latinx community and for the Black community and for the Asian community. So to Dr. Gill's point, there is we've done the messaging. We're continuing to do the direct messaging to the communities to try to get those folks who've been hit by this pandemic hardest signed up and pre-registered. So
Thank you. I see I'm at 5 minutes. If you can put me back in the queue, I have one more question. Thank you, Mr. President.
Will do. Thank you. I think we're going to let this go for a little while. If that's okay with my colleagues, because it's a good discussion and everybody has questions. Can I just do a very quick follow-up question? We're all frustrated with the current situation. I know the state, to be fair, is frustrated with the federal government as well and not getting enough vaccines on the front end. But if we have a different administration in a few weeks and we were getting 5 to 10 times the number of vaccines that we're currently receiving, we have 50,000 pre-registered or so. How many are we positioned to deliver in a week in Montgomery County? And what do you need from us to maximize that number?
Well, that's a hope that we hope that is a problem to have. It would be a good problem to have. So the infrastructure that we're building is under the assumption that we will be scaling up. So again, identifying additional venues, getting the staffing in place so that if, the state does come and say, well, actually, we're going to double or triple your supply, we'll be able to stand up and move that out quickly.
I would also add, if we got 10 times as much as we're getting now, we really would be pushing on the state to open up the private healthcare providers to that point, because it's not just that we're not lazy in terms of wanting to distribute ourselves. It's because people are more comfortable going to their primary care provider in many cases, and they may have a distrust of government that prevents them from wanting to come to us so we can get more of our community clinics and other venues involved. And so as we get more vaccine, we're going to ramp up. I think Dr. Gale's slide even said 25 to 3,500 per day is what we're capable of doing today. And so, you know, if you do that 7 days a week, that's 25,000. That's about 4 times what we're getting right now. And so I think when we get beyond that, I think there's more capacity that we could add. But also when we get beyond that, we really, really should be doing more than just Giants in Montgomery County. It should be available in a lot more sites.
Right. Okay. I can add that the Senate President is announcing at a press conference now a new special state committee to bring new oversight and accountability to Secretary Schrader and MDH on vaccinations in particular. So more details to come. Councilmember Jawando.
Thank you, Mr. President. And as always, Dr. Gales, Dr. Stoddard, Dr. Corl, thank you for your work. I'm going to go rapid fire to use my 5 minutes efficiently here. So on the disparities, I'll start there since you just ended there. I heard 44,800 total pre-registrations, Dr. Corls. You said 34,600 were white residents. That's 77% of the people registered. Or what were the Black and Latino numbers of the and Asian numbers for those three, for that, out of that 44,000?
So as of the 17th, we had 6,389 Asian Americans, or Asian in the Asian population, 2,104 for the Black community, and for the Latinx community, 2,453. And there was a percentage of unknowns in the group as well.
Okay. So yeah, obviously that's I appreciate you all pointing that out. That's like roughly 3 or 4% respectively for the Black and Latino community. Very low, very underrepresented. So I agree. We need to have a strategy. Well, I know we have a strategy, but we have to get those numbers up, and we can't have those disparities that DC had. It's just that's not going to be acceptable. So maybe you could speak to that, and I'll give you my other question so you can speak to it at the same time about what we're doing to ensure that and what else we can do. The private healthcare strategy, we obviously want that to happen. What's going on with the hospitals? What percentage do they have left, and how many have we received from them? So if you could answer those 2 questions.
So the what can we do piece of that, I'll start with in terms of the hospitals. I think to my earlier comment, we're messaging the communities in a more direct and targeted way. We needed to get the website up quickly, but we've also sent out messages through all of our portals, and we'll continue to do that piece of this. And we'll be working with community partners to encourage, to solicit their help in getting folks to register and online. The other piece of this is that the prioritization piece that you've talked about is one of the vehicles for trying to promote equity. So as we begin to invite people to be vaccinated, we'll have to do that in a way that is equitable and ensures the equitable distribution across all of our community.
We can follow up. I heard some ads from Prince George's County about the vaccine and test, targeted. I just think we need to double down on that strategy. I know Barry and others are working on it, but we can follow up offline. Quickly, Dr. Gales on the hospitals, please, or Dr. Stoddard, whomever is best to answer that.
So the hospitals actually have been working hard because the governor did put in a directive that if any facility that has not utilized 75% of their doses would be at risk of losing those allocations. And so they've been working hard to get their folks covered, but then also reaching out to us. So again, several of them reached out to us proactively several weeks ago. We've engaged them in those strategies. So to some of the earlier questions, to move those folks who are a part of the priority groups to them as potential vaccine sites as a short-term fix, but then also looking long-term in terms of how to partner to set these clinics up from a satellite perspective. Now, we're trying to get further clarification if, for example, the hospital allocations will be able to stay the same since those doses aren't being used for their staff, but they're also being used for the community folks. So that's something that we're working on in the background as well. The expectation, as Dr. Stoddard mentioned, is that we will be implementing and putting in those strategies as potentially early as later on this week to be able to stand up as additional sites.
Okay, so we'll have more raw information on that soon. Okay,
Well, I
good.
know Holy Cross actually opened up some appointments yesterday. They disappeared in 37 minutes. I don't know how many they opened. It was not a ton. I do know the Holy Cross received vaccine this week, but the Adventists did not because they had too much vaccine left over. I have a list here of they're all working through the details, so I don't want to list off all these sites because they're not finalized yet. But I can tell you, I see at least a half a dozen sites being organized by the hospitals right now that, as Dr. Gale said, are going to start this week, potentially into next week, including some of our sort of senior living communities, as well as sites servicing our 1A Tier 3 other healthcare providers. So,
all right,
I have a list here.
That.
Like I said, half a dozen sites. I don't want to.
Yeah, no, I don't want you to do it
have the
before you're
hospitals
ready.
here, but they're moving ahead.
All right, last thing I'll say, I got an email, I'll just paraphrase it from a Montgomery County teacher who's just underscores, I think, the confusion. I'll just read it in part. When Governor Hogan announced that Maryland was moving into 1B, I was elated. As a teacher, I thought there would be specific information about how we could access the vaccine. In fact, we've received no guidance or information. We've relied on word of mouth from colleagues to find a vaccine appointment in other Maryland counties, but not Montgomery County. This is incredibly concerning to me as teachers are being asked to potentially return to the classroom in March, and we have no information on how we will get the vaccine. I recognize there's limited supply. However, there needs to be better communication. I've tried to access the vaccine sign-up page, and more often than not, it does not work. I wanted to share my concerns with you. What would you say to that teacher, which I think a lot of us are receiving similar emails?
What I would say is we have, again, prioritized educators and recognizing that there is potential for them to go back to school. We have had a number of meetings with our colleagues at NCPS, as well as, I'm going to get the name, AIS, Association of Independent Schools for non-public schools, to have them start thinking through how they would prioritize their staff. And so this is multiple weeks in the works. Now, no information has been publicly released, but we can confirm and attest that both of those bodies have been working to develop strategies to be able to communicate to their staffs.
I appreciate that.
I think we all agree that we wish the governor would have talked to us a bit more about what he was planning to announce on Thursday before he announced it. Even if he was going to announce what he announced on Thursday, he left us in a lurch in trying to build these systems out. We are going to have a registration system, as Dr. Kroll alluded to, for non-75 and older populations in 1B and in 1C. We're hopeful to be able to launch that over the next week or so. They'll be able to pre-register there. But I think the key message I would have to that teacher is there are 73,000 75 and older residents, and we have prioritized 75 and older residents above others in 1B. I have 2 MCPS students who I am very anxious to get them back in the classroom as well, and would want our educators and staff to be vaccinated before then. We are working with MCPS to do that, but understanding there are 73,000 seniors that are over the age of 75 that we have to get to before educators. I think it's going to be a period of a few weeks before we get into other pools of 1B.
We just have to get
there's a substantial change in vaccine. If there's a substantial change in vaccine availability, we can get them sooner, but we have no reason to believe that's coming based on what we know today.
Thank you. Thank you, Mr. President.
Thank you. Councilmember Friedson.
Thank you. So do we know when the pre-registration will be available for the rest of 1B, including educators, and then for 65 plus? Obviously, the appointments themselves are a challenge, but when will the pre-registration be available?
So I can't give you a specific date on that. And the team has a long queue of things that they're trying to work on to get up right, including sort of response and notifications to folks who've automatically, confirmations of folks who've been registered. They are working on the other tiers in 1B, as well as the expectation that next week we will be able to make pre-registration available to those 65 and above. So the 65 and above is competing with everything else that we're working on. So that will probably be the first thing.
We need more staff resources to be able to do that. I mean, is that the issue?
Well, it's a little bit like cooking a cake. There are only so many hands you can put in that pot at one time and have it work. They're working on a website and figuring out what the language is and what needs to go into that pre-registration piece. So it's not an issue of staffing at this point. It's an issue of the staff that we have that know the system, having the time to work on it. And it has been prioritized both by DTS and by us in IT to get it done as fast as we can.
Okay. And then
we were intending to launch a SurveyMonkey link on Friday, but the team worked incredibly hard to allow a HIPAA compliant product to be ready on Friday. And frankly, they deserve a lot of credit for that. I'll say that I'll speak for myself, and I'll say I didn't have a lot of faith in that actually happening on Friday. I knew we were going to do a simpler SurveyMonkey just to have something up, but the team really came through, and so I'm confident that they'll come through this week too. We have 5 other languages that we want to launch the existing 75 and older survey in to address some of the disparities that we're addressing. So there is a few things that have to be worked on this week, but
you should know.
Go ahead. Sorry.
I was going. You should know, Councilman Friesen, we are meeting daily and working with the team to through the priority list and the issues, the very issues you raise, including the who else is in tier 1B that or in 1B that has to get invited for registration is in the works. I believe that the part of the plan is that a lot of that is still healthcare professionals and public healthcare workers, and so we are looking at modifying the existing healthcare part of that phase registration site to include folks in the B tier.
Okay, and then will 65 plus, will that be out at the same time that the rest of 1B, including educators, is out, or is that delay? Is that kind of after?
The 65 plus is I don't know which one is in the lead right now. We had 2 groups working on to get the portal up Friday. We probably will have more than one group working on getting these tiers done this week. So which one comes first, I cannot tell you.
65 and older is a little bit easier though, because I think we're going to utilize the same portal that we're using for 75 and older. It just needs a few tweaks to make it 65 and older. So it's a bit easier. So it'll come out. It won't be lagged by much at all behind the 1B, if at all.
That's right. That may be the piece that
and we'll find out shortly, and we expect that to be.
It will be available long before we'll have vaccine available to get people in.
Yes, it will. That's right.
That's the reality of it. So we're
and I appreciate that, but I think some of this is making sure that people understand what the process is going to be, and I think that's where we have fallen short. It's the clear communication of this is exactly how the process is going to work. This is where you go if you fall into this category. This is how you're going to find out. This is where you're supposed to get it. And when we don't have the pre-registration up and ready, and that's our process, it leads to the chaos and confusion and thousands of texts and emails and phone calls about, is this state site real? Is the Prince George's County thing something that I'm going to be able to do? None of us have the answers in an appropriate amount of time, and that's what creates the confusion. If we had the pre-registration up and ready, even if it's weeks before the vaccines are available, I think it will take some of the air of anxiety out of the balloon, so to speak, and help us out. Okay.
Well, Councilmember, just to say to you that I think that we're working as quickly as we can to get those pieces up and ready for folks so they will know. But a part of that is including folks who do pre-register in ongoing messaging, so they will have some sense of where they stand in the queue and what the updates are.
I appreciate that. Okay, last question. The criteria, I totally understand where you're coming from on that. The equity issues that we've seen in DC and other places around the country are very concerning. And I think most residents, if they were clear and understood what the criteria was going to be, would appreciate and respect where that came down, as long as it was clear and consistent and transparent. You've talked kind of in philosophical strokes about some of the things that you're thinking about, but at what point is that criteria of the numbers who have pre-registered and what it's going to be based off, whether it's certain by zip code or whether it's by risk category or some other criteria, when will that be available to us, and will that be available to the public, and where will it be, and how will it be communicated to them before those appointments get set?
As I mentioned, we're working on that right now, and also welcome you to provide any insights and input that you all may have as well in terms of recommendations. We can continue to discuss those, and once we've had a chance, because I think it is important for all of us to have ownership of that, because when folks ask those questions, it's important for all of us on this call including council as well as the county executive, to be on the same page so that when those messages are put out, it's clear that this is something that we've all agreed upon. I think that will be important moving forward. And so I would say we'll continue our internal conversations here. I would welcome any feedback and thoughts that you all have as a body and as individuals in terms of input to that, and will offer the same opportunity to the county executive. Now, the expectation is as we continue those conversations is that hopefully we'll come to some consensus and be able to put that information out within the next week.
If you could provide us something to provide feedback on, I think all of us would be more than happy to provide. Thank you, Mr. President.
Councilmember Glass.
Thank you very much, Mr. President. To all the doctors on, I know that we've been asking you tough questions. We've actually been doing that for the last 10 months. And what we're doing is voicing the concern and confusion that are being channeled through our constituents. And so I appreciate you answering as candidly as you are able. And I also greatly appreciate the questions from all my colleagues over the last hour and a half. Especially those that are focused on equity, recognizing that the demographic information you're sharing with us does not size up to the demographic data that we know of who has been greatly impacted by COVID-19 and who unfortunately have been dying in greater numbers from COVID-19. And so the follow-up question I have is about that information. And here, in Montgomery County, we have our own portal to sign up, to pre-register. And I just want to get a better understanding, and various colleagues have asked this in different ways, but as it specifically relates to the online portal, what can people expect? It asks for some demographic information, it asks for age as well, but what are we to expect in our email and in our text?
Not sure I understand your question. You mean in terms of signing up, or once you have signed up, or
once you have signed up, what are people expecting, or what should we expect, and how is that information on your end, the back end? What is the calibration there? With regard to the through an equity lens, making sure that the demographic information that is being asked of individuals, you understand the question.
So the registration portal asks basic demographic information, of course, date of birth, age of person, address, zip code, race, ethnicity, language spoken, and this is for the 75 and older group. Also asks issues about needing support in registering online and or needing potential having mobility issues or other kinds of questions that we might use to figure out how we get vaccine to them or get them to vaccine. So it's that data that gives us a chance to sort of then sort out how we would distribute, equitably distribute the vaccine at some point. Once they've signed up, we put this up very quickly, so we didn't have a chance to do this in the initial round. But what's being worked on now is this automatic notification that, okay, you're signed up and we will let you know, and a message that there is not yet ample vaccine available. And the next iteration of this that they're working on is to be able to give them automatic updates when we push out updates across the county, so that they get an update on where we are with vaccination. And what that message is will vary from week to week depending on where we are. When it is their turn, they will get an invitation through whichever portal, text message or email that says you can now schedule your appointment for vaccination.
And so, given the concern that I and others have expressed this morning about an equitable rollout, are we going to be taking into account the demographic information that is supplied by constituents when they go online and fill out that form?
I think that is exactly the plan. Sort of to Dr. Gale's point, we have to then sort out what the balance of criteria are and the information will be. But I certainly think it will include what we know about the transmission of the disease and what we've learned about the transmission of the disease throughout the course of the pandemic, but also and matching that with where people are, where they live, where their risk factors are, in exposure, so that we're cutting off, I think, as a priority, cutting off those routes of transmission and spread for the virus as a priority, and allocating vaccine that allows us to do that.
Okay. Thank you very much. That's all I have. I'll yield back.
Thank you, Councilmember Reamer.
Thank you so much. Quick question about building our own vaccination corps. Are we sending, if doctors, primary care doctors, veterinarians, dentists, if they want to help us as we get more doses? I know that right now we have more capacity than doses. We hope that that would change. Are we directing people to a location where they can work with us, or do we send them to the Maryland Responds network first? What's the process for that, please?
So that's a great question. And to all the folks at home, if you are interested in volunteering, we would appreciate and welcome your assistance in different capacities. So thank you for that thought. We are encouraging folks to register with the Maryland Reserve Corps, as well as if they are interested in supporting the county. Jessica Pryor is our volunteer coordinator. That may ring a bell from back months ago when we were talking about testing and other parts of it. And her email is Jessica, JESSICA.Pryor, PRYOR, at MontgomeryCountyMD.gov. But again, we are encouraging providers to go through the Maryland Reserve Corps for ease of administrative purposes that will help support our local team moving forward.
And because I signed up myself for that just to see what the sign-up system was like. Does there's a lot of training involved. It does appear as though it may be intended for a general audience. Is there, like, if you're a doctor, do you still have to sit through lots of training in order to be certified to come volunteer to administer vaccinations and so forth? Or do you know if there's like an expedited path for people who are health professionals?
Well, again, this is one of the reasons we encourage folks to go through the Reserve Corps, because they can do all of the administrative kind of clearances from licenses and those kind of things to help expedite the process. Now, once folks are identified, they'll be provided the necessary training. So even if someone may be skilled at doing the vaccine distribution, the actual, providing the vaccine, there may be kind of a systems 101 training that they have to sit through. But, it would be tailored specifically to the group based upon the credentials that they bring to the table.
Okay. I'm hearing from veterinarians that they are able to get vaccinated in other jurisdictions, not yet in Montgomery County. I've heard the same from NIH employees. We have NIH employees that are getting vaccinated in other jurisdictions, going to Virginia, not in Montgomery County.
We have definitely vaccinated NIH employees, because I know some NIH employees who have been vaccinated through Montgomery County. So
it wasn't, the assertion wasn't that no one from NIH is getting vaccinated. It's just that they have run out, I guess, of their own. But are you saying?
So NIH actually received doses directly from the state in certain parts of their institution for individuals who, by the criteria, met the criteria, in terms of prioritization. So, and any other individual who works at NIH, particularly if they're a resident of Montgomery County, if they meet the prioritization criteria, they are eligible to register in the system and to be vaccinated. Now, as far as veterinarians in our county, and consistent with a number of other jurisdictions, they have been placed further down in the queue, I believe in 1C. And so for us, that continues to be the case. I know it's in Baltimore as well, and potentially in other jurisdictions, they may have moved through, or as we talked about before, their prioritization scheme may be a little bit different from what we're utilizing here.
Okay, but if someone is a veterinarian, they're quite good at administering vaccines. It's a big part of the job. If they sign up for the Medical Reserve Corps, is it possible they would be vaccinated as well in order to be able to become a vaccinator? Because we vaccinate the vaccinators, right? We're doing that.
That's correct.
We've already done that.
Mm-hmm.
Yeah. Okay. All right, thank you.
Thank you. Colleagues, Ms. Henn's been waiting. If you can not use your full 5 minutes, that would be great. Council Vice President Albornoz.
Thank you. Confirm a couple things. I believe, Dr. Stoddard, you said earlier that there's still 15 to 20,000 folks in Montgomery County in 1A that still haven't been vaccinated. Just want to confirm that number. Is that accurate?
I think it's at least that. We actually estimated it was 30 to 40,000, but if we were being real about how many people are coming in, typically it's about 50% or more in a category at the beginning, and then sort of more as we go along. That leads us to that 15 to 20,000 number.
Okay, thank you. That's helpful. And then just an operational geeky question: who's managing the portal? Is that being done by DTS internally, or are we contracting that out?
That's being managed by DTS and HHS IT together.
Great. And early on in the pandemic, when the mass testing facilities were identified by the state, and obviously this is a problem we would like to have right now, that there were enough vaccines to be able to do large locations to be able to conduct vaccinations. But I know California has moved forward with this in the San Francisco area. They're using the football stadium in order to be able to move that forward. How are we engaged in those conversations with the state regarding the possibility, once there are a sufficient number of vaccines, to have a larger inoculation location, so that this time around there is a location in Montgomery County, as opposed to when the challenges with testing, where there were other jurisdictions that received larger locations before we did. Is there an opportunity for us to advocate, or are there discussions going on? Again, we're still months away from this being an issue, but just want to make sure the planning's in pace and the advocacy is going on right now to make sure we're one of them.
Yes, so those conversations are ongoing, but I do think that would create opportunity for advocacy on your behalf, to do that. I would encourage you to do that.
Okay.
I don't know if I can.
We are looking at some of our larger sites. So for example, we have some closed large department stores, and we also are looking at the Maryland Soccerplex as well. And so we don't have the venues like the convention center in Baltimore, or the stadiums in Baltimore, or in Prince George's County, unfortunately, or the large university systems, which often offer those large complexes too. But we do have a few locations that we've identified that are, I think one of the things that public health has recognized is that a big limitation of some of the sites that we currently operate was parking, and that's why they've expanded into the Quince Orchard High School, for example, which had a lot more parking than the site that we were previously using. So, like the White Oak Rec Center is a great location in terms of where it's located in the community, but it's kind of back in the neighborhood and has more limited parking. And so, in order to get more of those large sites, I think it's usually both not just internal to the building, but parking and other traffic control that are big considerations that we're looking at.
And then last two questions. In terms of data collection and the demographics, they speak for themselves. And I associate myself with all of the comments from my colleagues and appreciate our public health officials raising this as an issue in the first place. But do we collect that demographic data, or does the state collect that demographic data?
Collect that demographic data on our registration site.
Got it. So we do control
both.
And our pre-registration site.
Yeah.
I don't know if the state does or not.
Yeah, on your prep mod questionnaire, it does collect some basic demographic data and actually some basic underlying health condition data. When you fill out your prep mod, your information to actually pick a site, you're asked some demographic data, and you sign your consent form. And that's the data that's the state is utilizing to tell us who amongst those who have been vaccinated, what the distribution of race, ethnicity, and other factors is in that group.
Because that obviously has been immensely helpful when it comes to testing those dashboards, both for transparency, but also planning and more. And so, the more information we can provide on that, the better. It's good to hear we're allowed to collect some of that ourselves. And then I guess my final question is, there, as recently as last week, we heard reports that there continues to be challenges in communication back and forth between the states, sort of a who's on first kind of a challenge, to the point where I believe there was Dr. Gales's phone number was erroneously given as the point of contact for a website, which is absurd. So if our state public health officials were here on this call right now, what would you ask of them?
Where to start? I'll start and say I think we're looking for more of a partnership, more information before things are announced by the governor. is always helpful. I understand that that is politically complicated question, and sometimes they don't know what's going to be said when the governor steps to the podium. I think Dr. Gales has already alluded to what we were under the impression that was going to be announced on Wednesday or Thursday was different an hour before it was announced. I see his head nodding. So that, I mean, I don't want to, there's a lot of people working very hard at Maryland Department of Health, and I don't want to besmirch them in any way, but we get left behind on information and have to respond. We have to rush things out the door in response to comments, and that is never helpful.
Okay.
I think what I would add as well, technically an employee of MDs, if we talk regular with them. But I think, you know, to Dr. Steiner's point is a lot of, and even if it bleeds into these calls here, you know, a lot of the concerns that you get from your constituents are related to the governor had a press conference and said this, what is the county doing? And it puts you under pressure, and then it puts us under pressure because, to Dr. Stoddard's point, is the majority of the time, we do not have much lead time before decisions are announced, particularly in settings where we have been a little bit more thoughtful in terms of how we've laid those things out. And so it creates a situation where there is undue chaos. This is my editorial opinion, undue chaos, where it creates confusion, where it takes away from the heart of where we could have had a robust, comprehensive discussion with all of the parties at the table, governor's office, legislators, MDH, and local leaders, to be able to work through those strategies and solutions so that when things are announced, it's not, okay, this was said, how do we stand this up within 15 minutes or 24 hours, because now the public is a win of this. So enhanced communication, again, I wouldn't put that at the feet of MDH, but I think overall from the state level and the local levels, having better communication to help foster our ability to do our jobs.
Thank you.
Thank you. Councilmember Joando, speed round.
I'll try to keep up to my speed round last time. I know this, we mentioned it briefly, and I appreciate you crystallizing the point. Agree, the communication is not helpful. The email I read, you started off, I was elated when the governor announced, and then it devolved from there. And so much of our problem is that, and we just really need that there to be better coordination, because if we can have the messaging right, people will understand that we've got to move with what we've got to move with. And that's just the so frustrating part about this is, it's not the actual information. I think people are okay that we have a certain number of vaccines from the federal government. We just sound like we're not on the same page, and it's just unfortunate. My one question in the speed round, the folks that are in our developmentally our DD homes and folks that are trying to receive that have been signed up, I've gotten a couple of reports that they've signed up, they signed the consent form, they haven't heard back. Can you just talk about that process and how we're working to improve and get that very vulnerable population vaccinated, and the folks that work with them, obviously?
So anyone who is a resident of a group home, including the staff and the residents, will be vaccinated through the state pharmacy partnership. Excuse me. That pharmacy partnership went live when the state officially moved to 1B. So of the 400 some odd long-term care facilities, including B&D group homes, assisted living facilities, all of those places have a pharmacy partner that is working and coordinating directly with each facility to handle distribution of vaccine. For any individuals who have developmental disabilities or intellectual disabilities who are not in those residential settings, they are eligible for the vaccine in the 1B category. For staff who are taking care of them in a home setting, they are eligible, or support staff are eligible for the vaccine, I believe, in 1C category. And this was based upon clarification that the health officers requested from the state earlier this week. So hopefully,
you said 1C for that group.
Yes. Okay. So hopefully that answers and addresses that question. But for anyone who's actually in a congregate living situation homes, they are getting vaccinated through the pharmacy program that is similar to what the nursing homes had in place.
So any delay in that is due to the state partnership part. That's not, we're not giving those out. That would not be our.
Yes, we don't touch that process.
Okay. Thank you. I appreciate it. Thank you.
I may make one comment on what you said, Councilmember Joanna, earlier on about the challenges of the messaging. The governor announced last week that we're moving to 1B yesterday, and we're moving to 1C as a state on next Monday. I think it bears making clear the state is receiving approximately 72,000 doses of vaccine per week. We have somewhere between 100,000 and 140,000 people in our 1B phase.
Just in the county. Just in the county.
Yes. Just in Montgomery County. So if the state of Maryland gave us every single dose the state received, it would take us at least 2 weeks to vaccinate all of what's in 1B before we can move on to 1C. And so I think it bears reminder, like we've talked about this. If people think that we as a county are going to be able to move into 1C next week, I don't want to be the bearer of bad news, but we just have so many people in our 1B and are getting so little vaccine that, you know, we're not going to bypass 75-year-olds who, as I think Councilmember Reamer said, are dying disproportionately. We've got other categories like our educators who are important to getting schools back open and running. We're not going to be able to bypass those people to move into 1C next week, as the governor has laid out. We're making every effort to follow the prioritization that's been laid out by both the state and the federal government. And we have far more people in Montgomery County in tier 1B. It's the largest of the one tier, so it's bigger than 1A and bigger than 1C. So to think that we're going to get through it in a week when we haven't gotten through 1A in almost a month is, it's a mistake.
More vaccine, more communication. All right, thank you.
Okay, Councilmember Jawan, Councilmember Navarro.
Okay, Mr. President. So a couple of things. Hope that we can find a way to, get someone from the state. I know, Mr. President, you had mentioned that you reached out, or somebody had reached out. We tried to get somebody from the health department there to come to at least one of our briefings, maybe the acting health secretary, someone, but I think it would be worth for us to continue to see if we can do that. Also, in terms of this concern that has been expressed around equity, we've mentioned this before. I know I've mentioned this before. We're fortunate that we stood up, I think, a very robust infrastructure when it came to, testing, and when it came to addressing all of these issues with our BIPOC COVID-19 initiatives, our community partnerships, continuing the census complete count sort of infrastructure, partnership with our nonprofit organizations. I think we need to also bring in the school MCPS community engagement, the office there, Gilchrist Center, Regional Services Center, as well as small business partners in all of these communities. I think we have a very robust blueprint to do this, but it would be great also, I think, if we could incorporate at least one segment of these Tuesday presentations to hear about how we are now sort of morphing, this robust infrastructure for vaccine information and engagement. I think that's going to be super important. So I'd like to request that we do that. I've also mentioned in a couple of our meetings the idea of standing up some sort of like navigator teams within maybe HHS, maybe using our health promoter concept, because there are so many questions, et cetera, that having, maybe a team that can triage all of that would be, I think, worth our time. The last thing I wanted to ask very quickly, in terms of our GD community with the partnership with the pharmacies, how did those pharmacies get the information of who those providers are and, what are the residents? Is that, who gives them that information? Where did they get that from?
That's handled through MDH and through the federal level. We don't have. Got it. We literally have nothing to do with that program.
Okay. Okay. Thank you.
The state licensed them, to be clear. Yeah. The state's the licensure body for those.
Okay. Pumps. Yeah, because I had received a message and it was a little bit unclear where the person had mentioned they said HHS had apparently lost the names of a very large number of residents that were in some of these group homes. So I'm assuming she was referring to the state HHS department. So, but I think it's something that, again, I find that maybe these navigator teams are important just to troubleshoot that kind of information, because it is quite complicated and very confusing sometimes. So anyway, just wanted to make those two requests. Whether we could hopefully bring somebody from the state, but also get a quick briefing on where we are with our infrastructure for outreach and engagement to our BIPOC communities here in the county vis-a-vis vaccines.
Councilmember, on your question about the request, I've heard back from MDH twice that they are declining the offer to join our town hall, and I've spoken to the governor's office again during this call, and they are making a third attempt. So stay tuned.
Thank you.
Councilmember
Thank you.
Wrights.
Thank you very much. I'm going to try and be very, very quick. Prince George's has on their website that they're starting Phase 1C January 25th. I just want to make sure that folks are aware, because we will have questions, comments about what our neighboring jurisdiction is doing, mainly to the point, Dr. Stoddard, that you just made. So we have to make sure that that's out there so that people understand what the differences are and what's going on, because people will automatically assume that we're doing something wrong and that they're doing something right. But I want to get back to the equity part, because again, it was Kaiser that just came out 2 days ago with a report analyzing about equity in COVID vaccinations. And they talked about within our healthcare industry that we're still seeing inequitable distribution of vaccinations. A lot of the environmental services people who work in our hospitals, a lot of the janitorial staff and other support staff are not getting the vaccine at the same rate as the doctors and nurses, and contributing to, again, that disparity. Because if we are to assume that all of the doses are distributed equitably in all of the different facets, then we would not see such great disparities as we're seeing when it comes to race. And so my concern is the state looking at this? Because this is not exclusive to Montgomery County. Has there been conversations with the state about what we're seeing as inequitable that's happening across this country when it comes to vaccinations, and what we can do to correct this and get us back on track?
Yes, they are. They are looking into it.
Thank you.
The hospitals have reported that some of they've had issues with rollout, and some of that has been amongst the support staff. It's been more amongst the support staff than on the direct healthcare providers, which gets to this hesitancy question. That's not something we've forgotten about. It's just certainly it's been not as overt, because right now there's so much demand from people who want the vaccine. The hesitancy hasn't directly impacted this, but it will absolutely influence some of this inequitable distribution. And so that's not an issue we've forgotten about. It's one that we continue to talk about and work through. Ms. Vu from our Office of Community Partnerships and our Regional Service Center directors have engaged in all of our conversations, particularly as it relates to getting the information out about both the survey and other vaccine-related information. And that's why we're working on the translations of getting into, we really recognize this as a major equity issue. With the pre-registration process, though, at least we have a list of people from various demographics who have committed to saying, I want the vaccine. And so we can make sure in our allocations that, at least for those people who have said we want the vaccine, that it can be equitable and reflective of our community. Now, that becomes increasingly a challenge if people from various demographics don't pre-register in as many numbers over time, because we don't want to slow down the distribution, but at the same time, we want to make sure that it's equitable. So it really makes the hesitancy issue become a greater issue over time than it is today, and one that we've already begun to work on now, preparing for that future.
One of the last things that I would just say, just very quickly, is that we also need to make sure that we're working this in when we get to general population, and making sure that we're taking a look at prioritization for those who we know, again, are the most affected, either by case counts or by severity in terms of them contracting and what happens. And so it's my hope that as part of that rollout as well with our general population, that we'll work some of that in also, and make sure that we're intentional about telling folks that that is our strategy Others may not be doing it, but we here feel as though that's the best way to ensure that we truly are living up to the racial equity and social justice that we've committed to as a county. Thank you, guys.
Thank you, Councilmember Katz.
Thank you very much. I will be brief. I've had a few texts today that people are asking if they're afraid to go inside a store today, is there any place in the county that would have outdoor testing? Are you doing outdoor testing? Not testing, outdoor giving the vaccinations. Are we doing that in any outdoor venues?
Not currently.
Will we consider doing that?
I think all options are on the table. Certainly, potentially as we look at how we could scale up to larger venues. Now, recognizing part of the challenge with doing that is it's weather constraints in terms of, that's the biggest thing right now with the temperature and the weather in terms of those expectations. But, we'll keep all options on the table as we continue to grow and look at how we scale up.
Dr. Bridges talked about, I think the public health team has looked at like the fairgrounds, which obviously has a lot of outdoor opportunity to it, but that would be much more as we get into a broader distribution scheme.
Well, and the fairgrounds would have a covering so that it's certainly open in the barns area, but it would be something that that people would not have to go inside the buildings.
I would just note that I'm not a healthcare provider, but I can imagine that giving someone needle sticks when your hands are frozen may not be the ideal situation to do that in either. So I think it's sort of a balancing of the interest of keeping people safe as they come to the vaccine sites, but also making sure that they get a safe and effective vaccination.
It's certainly a comment that we've heard from the testing teams on cold days earlier on when they were outside testing about their hands and their ability to manipulate what they need to do to test people. So be the same for vaccines.
Thank you. Fair point. Thank you, Mr. President.
Thank you, Council Member. Did I miss any requests from my colleagues, including the verbal ones? Okay. Doctors, I think you've worn us out. So thank you so much for this exhaustive briefing. If council members have additional questions, you can bring them to our town hall tonight.
And we apologize to Ms. Hen for taking her interview time. So I hope congratulate her on her nomination. And sure we'll have some good questions for her.
We're all happy with her nomination. Thank you all so much. Appreciate it. Ms. Hen, you've been very patient. Are you still with us? Excellent. And
yes, I am. And the last time I met with you all, I did have some audio challenges. I did my best to ensure that doesn't happen today, but could you let me know if it is working today?
You sound great to me. Director Conklin, do you have any opening remarks?
I'm not hearing Director Conklin.
You've transferred your audio challenges to the director here.
Chris, I think you're on mute.
He's not on mute.
So it's my turn.
There you go.
Oh, there it is.
How about now?
Yes.
Okay, good. The issue is the battery died in these earphones a little while ago. So I'm really happy to be here today to introduce Hannah. Hannah's been with us in a variety of different capacities over the last 5 years. I think she brings to the department an energy and enthusiasm for trying different techniques to challenges that are either new to us or have been around for a while. And I also think she has a wonderful background of experience starting in consulting engineering, working in the real estate industry, working for the Economic Development Corporation of New York City, all before joining us. So it's a really nice portfolio of experience, and we've had a great time working with Hannah in all the roles that she's had. And I know you're running behind schedule, so I won't spend any more time giving you detail, but Hannah has my enthusiastic support for this appointment. I know we've talked with some of you before, and I look forward to the questions today and moving forward if the council decides to with her confirmation. So with that, I'll hand it back to you, Council President.
Thank you so much, Director. Ms. Henn, we're all so pleased that you're willing to serve in this role. I have 7 questions for you, and my colleagues may have additional ones. The first, could you tell us about your professional background and how that relates to the specific responsibilities of the Deputy Director of the Department of Transportation?
Yes. First of all, I would like to say thank you for the opportunity to speak with you all. I'm, very glad to be here and share more about why I'm so excited for this potential opportunity to serve as Deputy Director for the department. My professional background really comes from was rooted in my childhood, where I was born to a rural farming family in Maryland, and that was my father's side of the family. My mother's side of the family was an expat family that, as a precursor to USAID, she grew up all around the world. And as a result, my parents then decided that they wanted their children to have that experience. So I grew up across Southeast Asia. After my early years on a family farm in Maryland, I moved many, many times before now settling in this region. And as a part of that, living in multiple cities, multiple countries, spending my summers usually back here on the farm, it was always really fascinating to me to see how things are done so differently, and how across the world, in extraordinary and ordinary circumstances, different tools are used to overcome challenges. So that has driven my passion for innovation and questioning, and always trying to think differently and not stay rooted in solutions that just because we've been doing them already. Ultimately, I pursued a career in engineering because I was passionate about math and science and thought that that would be very transferable to have a similar life traveling the world and, experiencing different cultures and, living a life with diversity, which I was really seeking. Ultimately, I have found that in the metropolitan Washington region, rather than living abroad. And I'm so excited to continue to bring those skills to Montgomery County. I have been working for Montgomery County for 5 years now. I was initially attracted to the county by the Purple Line project. Previously, I worked in New York City, and my focus there was on bringing new transit projects to the city. So I worked rather than working for the Department of Transportation in New York, I actually worked for the Economic Development Corporation. We had a transportation group that was really focused on taking new approaches to transportation that would then drive economic development. Mayor Bloomberg had recently rezoned much of the waterfront of New York City. So my focus was on developing a 5-borough ferry system. So ferries not for pleasure, but really truly for commuting and providing access to those newly rezoned areas that did not have access from the existing infrastructure that had been built at a time when those areas didn't require such types of public transit. They didn't have that density of population. I ultimately decided that Montgomery County area is where I would like to settle after quite a bit of moving around for my husband's professional training experiences. And once I was able to join the county for the Purple Line, it's been a fascinating experience. I helped to negotiate the Purple Line memorandum of agreement with the state. And then after that, once I got to know this area better, I moved into the role of strategic innovation engineer for the department. So it has just been wonderful to work in a place where new ideas are encouraged and where I can really focus on cross-silo efforts among the different traditional divisions of the department. And most recently, I've been serving as the acting communications manager and really been able to delve into sharing the great work that we're doing with the public and trying to help communicate more clearly, translate from engineers to the public.
Okay, thank you. Accomplishing the goals of Vision Zero will require significant improvements in engineering, education, and enforcement. The engineering component rests squarely with DOT in association with State Highway Administration. Which new engineering initiatives do you advocate that DOT and SHA should undertake?
I would just start by saying that I'm a true believer in Vision Zero. I was working for New York when then Commissioner Polly Trottenberg at DOT and Mayor de Blasio brought Vision Zero to the U.S., the first major implementation of Vision Zero in the U.S. So, while I'm a great believer, I also have very strong memories of being in a room with the mayor and Commissioner Trottenberg explaining to us that we would be delving into Vision Zero and how, I try to keep in mind in any work that I do, not to assume that everybody else, you need to bring people along with you and remember that even though we might all be thinking Vision Zero all the time, not everybody is. So one of the important aspects of Vision Zero that really supports engineering, in my view, is better communicating what we're doing. And one example that I will share with that is that we are implementing, in my opinion, fantastic new tools for people in the county. One example of that are the pedestrian call signals to help for safer walking. We call them hawk signals. I have noticed that the signs that tell you how to use those hawk signals are different in Montgomery County and the district. So on Willard Avenue in Bethesda, or in Frederick Heights, there's a hawk signal that tells you how to use a signal, tells drivers how to react. You turn around the corner onto Wisconsin Avenue and you're in the district, there's a hawk signal that has completely different directions. So I think that there's actually, especially when living in a region where people cross borders, they're in many jurisdictions, I think that there is a lot of benefit. We can get more out of these engineering investments that we are making by making them more consistently explained, ensuring that you don't need to speak English to understand how you should be behaving, reacting to our roadways. If you have vision disabilities, you can still navigate our roadways. So I would like to really emphasize the communication side of the engineering investments we're already making, the spending that we're doing. Recently, we I led an application to COG for a Transportation and Land Use Connections grant, and we are now working on a project, doing a lot of research across the country, working with the community to develop regional solutions for people who are traveling with vision disabilities. And so that's a next step that I'd really like to bring into the engineering work that we're doing to get more out of it in terms of safety. I'd also like to speed up implementation. So we are hoping to develop, both SHA and DOT, I think, should develop more design toolkits. So when we do public engagement on projects, if we can, adapt our public engagement to do larger, more inclusive public engagement that then allows us to do our projects more quickly rather than restarting with every project that we do. I think we could develop some efficiencies there. And also developing design toolkits. So for this year's COG TLC grant, we are going to be applying for assistance to take what we learned in shared streets and develop design toolkits to help the permanent neighborhood greenways move ahead more quickly by not starting from scratch with each location for putting those permanent neighborhood greenways in place.
Perfect. Okay. Thank you. Accomplishing the reductions in carbon emissions is also a difficult challenge. What new initiatives do you advocate that DOT and SHA undertake to achieve this objective?
So one of my strongest interests within this realm is based on the fact that the vast majority of our carbon emissions are created by driving in private cars. I am in no way suggesting that cars do not serve as a very important option for travel in the county. However, going beyond what type of mode people are using, traditionally our focus has been very focused on the commute trip. However, about 80% of the trips that are made are not for commuting purposes. And I see so much potential in taking our transportation planning efforts. You know, we have this fantastic group within DOT Commuter Services that traditionally has worked very closely with employers to help them find alternatives to driving single occupancy vehicles to get to and from work. But people don't just drive to and from work in the real world. You know, they have after school programs they're trying to get their kids to, they're doing errands, they have a doctor's appointment in the middle of the day. And I would like to, while supporting commuting trips, if we could get some of those other trips off of the road or shift them to different times of day, we have so much potential to impact congestion. And, you know, Councilmember Glass, I know you were a key lead on expanding Kids Ride Free. That is something that I would like to continue to build upon. That's been a very successful program. And if we can work towards providing better and more reliable transit to the point where kids prefer to take that and aren't always asking their parents to take them to an after school program, I think there's great potential to get cars off of the road, and also get them off of the road now in these after school program type times, but also build a culture within young people in Montgomery County so that they're more open to choosing different modes of travel in the future.
Thank you. Montgomery County is partly urban, partly suburban, and partly rural. Where should transit improvements take priority, and where should adding roadway capacity take priority?
So we have an existing roadway network that covers most of the county. I feel very strongly that these two priorities are not in conflict with each other. You know, we have, you know, of course the specifics vary, whether you're in the Ag Reserve or in downtown Silver Spring. Certainly we have different conditions, but in many of these cases, if we can make, you know, improvements on roads, change some signal operations that help vehicles get through those roads and open up existing capacity. My early career was actually, part of it involved adaptive reuse of existing structures, not roadways, but, you know, huge old power plants. And that set my perspective, really opened up my mind to using what we have. So I would be very cautious about constructing new roads, because I see so many tools that we have to make better use of the infrastructure that we already have. So that would really be my focus in opening up capacity, which would help transit be better, which would then hopefully attract more people to transit and continue to open up roadway capacity for those people who really do need to travel by car.
Excellent. Economic development is a top priority of the council. What projects that are not already programmed by the county or the state will produce the most bang for the buck in promoting economic development?
So as I mentioned earlier, I worked in economic development for New York, and that I always have that lens when I'm thinking about a project. I truly, you know, many of the engineers that I work with at DOT, I think were attracted to this realm, professional area, because of a childhood passion for trains or cars, or, you know, playing with things with wheels. Truly, that was never an interest of mine. I'm really interested in the end goal of transportation and using transportation to develop opportunity, both in terms of job opportunity, but also living in New York. I had so much exposure to people who had extremely long commutes, and I'm, really personally invested in building better connections between where people live and where they work, so they can spend more time with their families or doing whatever else they would rather do than be sitting in a vehicle. So part of that, I think, is I'd like to bring transportation more into the discussion of economic development. And also, I would like to use my communications experience to better communicate the work that we're doing and what it's accomplishing and why it matters, and why a fantastic transit investment in East County could increase the tax base, and that tax base could then support investment in another area, and that really a success in one area of the county can contribute to the success of another. So specific examples would be continuing to move forward in our bus rapid transit and telling a story associated with the bus rapid transit to, bring people on board. And I would like to ensure that we can translate our transportation story to external investors in addition to internal. So I think the Great Seneca Life Sciences Corridor is an example of something where we have really focused on explaining that story in a way that people can understand and care about, even if they have never looked at a bus map. And I think there's a lot of benefit in simplifying our story and making it compelling to outside investors. And the last thing I would say on that is that, since I've been in Montgomery County, often when I try to bring innovative ideas in, I hear, Montgomery County isn't New York, Montgomery County isn't DC, Montgomery County isn't, any large city. But Montgomery County does have so much to offer that many of these other places don't. And I would like to bring transportation into that story of what Montgomery County is instead of what it isn't, and really try to focus on those, the transit investments we're making, the bikeability, walkability, and electric vehicles in particular.
Could you elaborate on that just in a nutshell? What do you see us having that these other jurisdictions don't have, those two in particular?
Well, one thing I mentioned earlier is the diversity of the community. I think in terms of seeking a talent pool, it has something to offer anybody. If you want to live in a high-rise apartment building, there's a place you can do that in Montgomery County. If you want to live in an ag reserve and still be able to commute to a major life sciences job, you can do that. And that is something, and the budget and the decisions that are being made in terms of investment are forward thinking, but also there's a lot of careful public engagement that's going on. And so many of those things have potential to attract talent, and that is something that is important in economic development and in attracting investors. And I've been thinking a lot about, particularly in the work that I've been doing on developing bus rapid transit, trying to support us in being very positioned to be competitive with our neighbors. And part of that effort, we've actually recently been working with APTA, the American Public Transportation Association, and we're a member, but they have actually fantastic resources on developing messaging, and they support people all across the country, transportation providers, and we have been using that free resource, again, finding maximizing the resources that we have to help us to think about how we can tell our story in a more compelling way.
Thank you. Racial equity is another top priority of the council. How would you measure the achievement of racial equity for a transportation project or program? And what measures would you take to advance racial equity in the transportation CIP and in the operating budget?
So I've been working very intentionally in racial equity since my first job out of college. When I worked in construction management, I volunteered to take on all of the minority women and disadvantaged business enterprise hiring because it was frustrating to me that people who were running those programs seemed to be checking a box rather than really being invested in their success and the reasons they were taking place. So that was kind of a foundation for me in graduate school. I did extensive study related to economics and racial equity in my public administration work. And most recently, I volunteered and was selected to be the racial equity and social justice lead for DOT. So in the past months, I have been undergoing the training led by Tiffany Ward in her newly established office. And, I will by no means claim that I am an expert in the field, but I'm give that background just to explain that I genuinely am invested in the topic and have been trying to learn as much as I can and support the work for many years now. So much of the focus from the collaboration and learning and training that we have been receiving has been on systemic change. And, I take actions in my personal life, but I see an opportunity through DOT to truly implement systemic change. And I'm a strong believer that as representatives of government, that is a very important duty that we should all be working to fulfill. So one example that I will provide that I'm really looking forward to, hopefully in this position, taking a lead on is the project that is currently programmed for reevaluating our ride-on route structures and taking a comprehensive look at ride-on across the county. And I will say that I think an important part of moving racial equity issues forward, something falling down over there, is sometimes having difficult conversations and sometimes having to take things away from people that are important to them in order to shift our resources to different areas. And that can be a very sensitive issues with bus systems. So if you have always had a bus stop in your neighborhood and we take a comprehensive look at the county and really focus on equitable service and addressing past inequities and the fact that, our land policy, our land use history is just very unjust. And and all of that is to say that I'm excited to work on rethinking our transit network and the connections and working towards making some systemic change.
Great, thank you. And finally, are there any conflicts of interest that we should be aware of?
No, I have no conflicts of interest that I am aware of.
Okay, great. Councilmember Glass.
Thank you very much, Mr. President. I'll be brief, but Ms. Henn, I really appreciate everything that you've just said and the manner in which you talked about it. I know that your work as the representative on the county's Vision Zero steering committee has been important, so appreciate your thoughts there. We still need more to do. We still have more to do, and your insights there will be valuable. And also appreciate your comments about Kids Ride Free and expanding that. Over the last number of years, Councilmember Albernaz and I have had a number of conversations about expanding similar programs for rec and getting kids to those after-school programs and activities, as you've mentioned. So we need to do more. I look forward to working with you. Just wanted to say thank you and appreciate all your comments. And I yield back. Thank you, Mr. President.
Thank you. Councilmember Navarro.
Thank you so much. Thank you for the opportunity to have this conversation. I know you've been here since 2017. I think the Kids Right Free program has a very long history, and previous councils worked really hard when it was basically slated to be eliminated. I know I led the charge to make sure that that didn't happen, and I'm really glad that my current colleagues have taken the leadership role in that as well. I did want to go back to a bit of the conversation of the intersection between racial equity, social justice, and economic development, specifically how transportation plays a pivotal role. As you probably know, this council did adopt an economic development platform that included quadrants that addressed issues of transportation, housing, workforce development, which you alluded a little bit, and then also business development. But in reality, and what drives that economic development platform is really an ultimate desire state to achieve racial equity and social justice in the county. Because every single issue, obviously, that we're facing has a direct impact with regards to equity, given that Montgomery County is majority BIPOC county. So no matter how you slice it, every single policy decision that we make, every single component has to be really driven and steamed through this lens. So I just wanted to hear a little bit more about, your take on that, not just about issues of engagement and outreach, because everybody talks about that all the time, but really how would these communities, basically our broad community, how will they be protagonists in all of these major issues that affect our county as it's rapidly changing? How would something like this economic development platform with all of these components that are really, truly, I think, connected through this conversation of transportation, because mobility is so critical, what will you be doing to make sure that our county residents are basically front and center, and that everybody has that voice, not again from the perspective of, well, these are pockets, but the fact that these are the majority of our county residents. Therefore, the approach has to be done in that authentic fashion and not just as a kind of nice thing to do in this column. So how would you be addressing that?
So I have a few ideas come to mind from your question. One, I will use the US 29 flash as an example. Again, earlier I said that there has been so much focus on the commuter, and I think that the flash on 29 is an excellent example of really serving any type of use along that corridor. So the traditional way of planning is to think about peak periods for commuting travel, but not everybody travels at peak periods. People have different types of jobs. They have different needs at different times. So flash, the one aspect of it that I would love to see more across the county is that it has the same schedule. When it is running, it's running on the same schedule. You don't have to worry about, if you travel to work at hours that are different from the traditional peak, you get the same quality of service as somebody who is commuting to a white collar job. And that consistency of service is also in both directions, which I think is very important. It's not all taking one community to one work location and then bringing them home at the end of the day. It is equal access in both directions at all times of the day. I think that's very important for providing flexibility and acknowledging that people have different commuting needs and different needs in terms of accessing jobs. It also connects people to Metro. So it gets you to Metro faster so that you can go anywhere. And ideally, towards the top of the line, if more economic development could happen because of that fantastic connection in the opposite direction of a traditional peak travel, it makes them more competitive in terms of attracting employees from other locations. And back to the Kids Ride Free, if we can provide ways for children to be children of all ages, through into adulthood, to have high quality transportation, if we're looking ahead to the future of the county, those kids, a child whose parent can't drive them to an after school program would have equal, or, we're working towards equal access to programs and learning that don't require having personal assets in order to access them. So, I could go on if there's something further you want me to, those are just some examples, but.
Well, I think that given the fact that we adopted a racial equity and social justice law, and that every single budgetary decision that is made, so when the executive sends over the budget, there has to be an analysis as to how this promotes, racial equity and social justice. The point of this effort was so that we wouldn't be doing one-offs, but that eventually we would be building in a structural way of addressing equity in the county. The things that you just described definitely were the intention behind the Flash in the East County, et cetera. But I think that what I'm going to be looking to, in your role, is then how, when we do get the budget request from the executive, how all of these issues of equity are built into that. Obviously, Kids Ride Free, it's all about resources. The purpose of it, we've known for a very long time, and we've understood how certain areas of the county were disproportionately affected because kids didn't have parents that were able to just drive them places. I live in the East County, so I know what that was like. But I hope, and I'm looking forward to, in your role, to how, there will be that footprint of equity being addressed through the budget specifically, and what initiatives would be addressed. Now more than ever, I think it's become, a real concern. So really appreciate the conversation, and I look forward to your role in this space. Thank you.
Thank you. Councilmember Reamer.
Thank you. Really pleased by this appointment. Thank you, Director Conklin. You've been one of the most creative, innovative officials, and we're just really thrilled by your work. So I look forward to working with you. Thank you so much.
Thank you. Councilmember Jawando.
Thank you. Ms. Ham, good to see you as well, and really appreciate Director Conklin, the work that you two have done together over the last several years. And Ms. Han, I appreciated your help and guidance. We talked a lot about VRT today. It was great to be there with you outside to get the tour and talk about some of these issues, and then also speak after that. I think you've touched on many, many, many things that I care about, and I'm glad that you care about them too. I won't say you did it because I care about them, but I'm glad that you talked about it. Like the comprehensive review of the ride-on system. Every time I talk to Director Conklin, I bring this up, and I know he really wants to see it happen as well. And to your point, the laser focus on equity and making sure service is consistent and stable for everyone who needs it, but also expanding it, and how much, just a small bit, if we just transfer just a few people, that helps our entire system. And so I really appreciate your approach. I won't put you on the spot, but I will say that you've kind of mentioned it. Kids Ride Free, it was proud to support that continued effort. I've said, and many of us have discussed, and there's a national discussion about what is the future of public transit in the context of what's going on with COVID. But I think one of the things people don't understand is, and we proved here with the study that Councilmember Glass pushed forward recently, that people who need transit have continued to take transit, and they will continue to do that. And that our system, while our economy will adjust, there is still going to be a lot of need to get around to these different types of trips and transit and the like. And so I think we need to continue to evaluate the utility of going to an all-free system. I think, and I would like you all to, I know we've talked about this before, and so I won't put you on the spot. You can comment if you'd like, but I think moving in that direction in light of where we are in the country and county's history is something that we all need to be looking at as we try to focus on equity, but also make sure we improve our overall connectivity and economic development. Thank you, Mr. President.
Thank you, Council Member. Okay, I think that's, Council Vice President Albornoz.
I'll just be really quick. Thank you, Ms. Henn. I appreciated your responses, and I do think Director Conklin's been doing some great things in DOT. So look forward to supporting your nomination. I would just put in a quick plug. You don't need to respond, but just, Councilmember Jawander just touched on this in terms of the response with regards to COVID and the public health crisis before us and public health infrastructure. As chair of the HHS committee, one of the biggest challenges we have is getting people to and from doctor's appointments. And so it's an example of, as we look and think creatively about the different mobility options that we have within the county. And, as you pointed out correctly, we structure this in terms of, too much, the 9 to 5 framework, 5 days per week. But it's in the public's own best interest for us to expand that really dramatically and think radically different about how we're getting people to and from critical points of location across the entire county. And I think after school programs is a really good example of that. But there are these micro needs that have profound impacts on the quality of life of residents, but also have major implications from a public health standpoint. So I know that DOT's been heading in this direction for a long time, but I would just encourage you to think about that within that broad scope as we look at different solutions. And I know this council has in the past and will continue to stand ready to support that creative thinking and thought process and solutions to these very real challenges facing our residents. Thanks.
Thank you, Council Vice President. Okay, I think that's all the comments from my colleagues. Ms. Henn, we're so happy to consider your nomination. Thanks, I'll just say as the local council member for your focus on transit projects in East County. I think the last time we were able to see each other in person was at the Flash Bus launch, and that's been a tremendous success even even during this pandemic. And we appreciate that you have very big shoes to fill, but I think we're all confident that you're going to be a success in this role. So thank you, Director Conklin. Thank you, Ms. Henn. And I think we can move on.
Thank you.
Thanks very much.
Thank you very much. Great to see you. Okay, colleagues, we have an action next on the agenda is a special appropriation to the county government's FY21 operating budget, $2,500,000 for the conference center non-departmental account, NDA, source of funds, general fund, undesignated reserves. Funds
we need a motion? If we do, I'll make the motion.
Second.
We do need a motion. Councilmember Reamer makes the motion. Councilmember Friedson seconds the motion.
Maybe council staff could just share for the public.
Mr. Smith?
Very good, thank you. The council approved in July a $1.5 million appropriation for the same purpose. The county has a management agreement with the conference center, and in years when the operating loss or when the operating budget has a loss, the council needs to appropriate money to cover that. Every year since the conference center's creation, it has created revenue for the county, but unfortunately due to the pandemic, we need to continue to provide funding for the operating losses. So $2.5 million that's before the council today will support the rest of the fiscal 21 operating losses. And council staff expects a similar situation in the recommended March budget for fiscal 22 if the need remains. That is all. Thank you, Council President.
Thank you. Can you comment at all on any steps they've taken to minimize their expenses this year?
I can, but I'm also joined by executive staff who are more familiar with this. I know that they've done a lot to reduce operating expenses and are operating at a bare minimum, but I do not have additional details at this time.
Ms. Semple, welcome.
Yes, good afternoon, Council. Thank you very much. I'm Ruth Semple with the County Executive's Office. I have been working with Tina Benjamin on the conference center now for a couple of years. So over at the conference center, there have been furloughs and severances. The staff is now down to bare minimum. If you were to go over to the conference center, you would see that is essentially closed. They have just a minimum of security, utility expenses, and just a minimal staff in the sales office to cover things like cancellations. They're continuing to book, in the future. Even very senior management has occasionally served themselves as wait staff when they've had very, very small meetings to accommodate. They have also taken steps to produce additional revenue for the conference center, such as hosting Soul Cycle in the tent on the parking lot during the better weather months, and are getting ready to execute a contract that will allow for some indoor sports like a Topgolf type of setup in the facility that will help generate a little bit of revenue. So they're looking at lots of ways to generate revenue, even if it's little bits, and looking to cut expenses as much as possible.
Terrific. Thanks. I don't see any questions, so there's a motion.
Just a real quick question. I have no idea if this has been discussed at all. I know we just had a very robust conversation about vaccinations and particular spaces that could be used for that purpose. Just, if someone can just let me know whether there have been any consideration, if needed, to utilize the center for such an activity. I'm sure there are some limitations, but would just be curious, given that we just had that particular conversation a few minutes ago.
Mr. President, just a quick response for that, because I asked the same question. Is in District 1, as you all know, there are ongoing conversations about using the site when there are available vaccines, potentially in partnership with some local hospitals. I know the health department and emergency management is having that conversation, given the fact there is a parking garage and a very large space and the ability to partition rooms for different aspects of that. So not a lot more details than that, but the answer to the question is I know that executive staff and the health department are in ongoing conversations specifically for that, among other large sites in the county.
Wonderful. That's really good to know. Thank you so much.
Ms. Semple, anything to add?
No. Any other questions?
Any other questions for my colleagues? Seeing none. Okay. Thank you so much for appearing. There is a motion on the table here. All those in favor, please raise your hand. That is unanimous. Terrific. That is item 5. And then item 6 is the consent calendar. I need a motion to approve the consent calendar.
So moved.
So moved.
Councilmember Rice moves and Councilmember Navarro seconds. Councilmember Reamer.
Thank you. Thank you very much. Well, I wanted to highlight for my colleagues an item on the agenda. It's the item I, the last item on the consent calendar, which is the introduction of a special appropriation for $500,000 to the organization Connected DMV to help develop and advocate for a new global pandemic prevention center right here in Montgomery County. Our county is one of the biggest biohealth clusters in the world. We're home to NIH and FDA and numerous private sector leaders and companies. And we are the natural choice to host a critical new agency. We have the opportunity and we need to act now. We need to think big and move fast to close this deal. Connected DMV is a regional nonprofit organization. It's convened a very broad group of stakeholders from the public sector and the private sector across the capital region. And they have identified a global pandemic prevention center as a key to limit the turmoil, loss of life, and economic devastation that we've suffered at the hands of COVID to prevent it from happening again. Among the many initiatives, the Prevention Center would initially develop and maintain a stockpile of monoclonal antibodies that the U.S. government could rapidly deploy against future pandemics. We're hoping, Connected DMV is hoping for a multi-billion-dollar federal investment, which would be fantastic for this country. And hosting it here in Montgomery County would be, of course, the right and logical decision, and one that would help this county continue to advance our role as a leader where breakthroughs happen. It's important to keep in mind that this is not the only proposal out there to create a pandemic center. There is a lot of urgency, I think, to be ahead of the competition and to position ourselves successfully. And so it's another reason why I think it's important for us to move quickly on our funding strategy right up front and clarify how we are going to be significant backers of this and help make it happen. There's details in the packet for this item about their budget and their strategy and their vision of the initial effort being to to identify pathogens, research antibodies, take them through clinical trials, and then hold them in reserve or stockpile. So we'll still figure out how we're going to have the discussion about this item. We can, I think, presumably take it to the Fed committee. And I know that, as I said, this has been a very broad regional effort. Montgomery County has been at the table throughout. I want to recognize the work of Tina Benjamin, who's been involved, Rich Bendis, and both, of course, representing the county, and County Executive Mark Elrich as well. Thank you very much, and I certainly encourage my colleagues for their support. Thanks.
All right, do we have a consent calendar? All those in favor, please raise your hands. Terrific, that is unanimous. Okay, we have a properly approved consent calendar. We are now on recess until our 1:30 public hearing. Thank you, everyone.